Okay, let's get on with this. We're looking at some movement analysis. We really want to upskill you, I suppose, not just around the notion of movement analysis, but I'm going to touch a great deal here on the muscular system, and I'm going to touch a fair amount here also onto the skeletal system, and of course how those different systems interact, a theme which comes across really, really strongly in your GCSE. So we're looking at Laura here. Here's Laura. She's one of our athlete profiles. Laura's put her over here. They've undoubtedly chosen a bad colour to try and write on top of some people with different coloured jumpers, but never mind. Laura over here, and we're interested in her performance here, especially this particular image, because it allows us to actually address certain types of movement analysis from this single picture. And I'm going to keep referring back to this as we go. For you guys, I'd really encourage you to get down every word and every note I make here on the screen, and there will be additional things in my speech and how I describe this stuff as well. So there's my challenge to you. Can you concentrate on the live show and get as much done as possible? If you're watching it on review, on demand, can you pause and take the information in that you need to take? So, all that being said, in fact, one other thing I do want to say to you is I'm going to look at 4 joints right now. Okay, so 4 different areas of movement I'm going to look at, and those 4 joints I'm going to consider to be the major joints: the hip, the knee, the shoulder, and the elbow. Okay, I'm not going to. I know some of you guys on some of your exam boards you look at the trunk, and you also look at the ankle, because that isn't universal across the exam boards. I'm not going to touch it here, but these 4 are. Okay, so that's the thinking behind that. Right, all that blabbering on. Let's get on with it. So I want to focus on the hinge joints first of all. And they're kind of useful to have a look at in combination, because they basically work in the same way. So of course over here we have the elbow. That's fairly straightforward. And over here we have the knee. There's not going to be any prizes for naming these things, but there we go. So we've got these 2 hinge joints, the elbow and the knee. And really the point I'd like to get across to you is that these hinge joints, they move through one single plane. And we're going to come to planes later on in this particular session. But of course you can probably already tell me that this is through the sagittal plane. If you want to write sagittal down, it's got a single G and a double T. So these, again, I'll come back to planes later, but these hinge joints move through the sagittal plane and the sagittal plane also only. We could also say that of the ankle for those of you that study it, even though it does move slightly through the process of inversion, eversion, left and right. But anyway, let's not worry about that. So let's look at the elbow first of all. I want you guys to recognize that I have got this muscle here, well, we all have, on the front of the upper arm. I've made it look like some kind of hot dog sausage with some mustard on here. And of course this muscle we know is the bicep, and if you really want to be super posh you can call it the bicep brachii, and if you do use the brachii it's 2 eyes on the end. You don't necessarily need to use that word. Bicep is the key. It has an S on the end. And of course on the back of the arm we have this muscle here, and this muscle is the tricep, and again you can apply the same principles there. It's got an S on the end of tricep, and brachii again is its second word name. Okay, so you can use brachii if you want to. You don't have to at this level, but it's there if you want to use it. So these 2 muscles are both going to work to move the elbow, and then beyond that what I want to do is I want to have a look at the different bones that are involved here. So this big bone up here I want to refer to as the humerus. So the humerus is the bone of the upper arm. Let me finish it off properly. And then here, if you look at this bone here is the radius. Okay, the radius. And that's on the thumb side. So if you look at your forearm, the radius is on your thumb side of your forearm. Okay, and now really interesting is this other little bone under here, another long bone. And this, of course, you probably could tell me, but this is your ulna. Your ulna. Now, you might not think the ulna is a very exciting bone. 2 things I personally think are fascinating about the ulna. One useful, one for this level, another not so. The ulna and the radius actually have a joint all by themselves. That's just above the wrist, called the radial joint. I'm not going to go on about it anymore because we don't study it at this particular level. But what I think is really interesting is at the point of this ulna over here is the insertion point of what muscle? The tricep. So the tricep, when it pulls, actually pulls this thing in that direction to straighten or to extend that elbow. Okay, so I think that's super important. And When you go a bit further with this, you're going to, in fact, some of you study lever classifications on your course. When you look at lever classifications, it's this very point of the ulna. It's actually got a name of the olecranon, if anyone's interested. But this point of the ulna makes this a very particular and specialized form of a lever system when we are extending the elbow. So, of course, we know that straightening the elbow is called extension, and that is powered by, as I just said, the tricep brachii. And we also know that if let me choose a better color than that. We also know that if we curl the elbow in that way, this is what we call flexion. Okay, so we want to get that nice and clear flexion in there. So flexion is bending at the elbow, extension is straightening at the elbow. So, and I should say as well, flexion is caused by a concentric contraction of the bicep, okay, which causes this pulling. It pulls here on the radius, look, and pulls the forearm upwards to bend, to decrease the joint angle. We call that flexion. And as I said before, that all happens in the sagittal plane. Let's move on to the knee. Very, very similar sort of situation. This time, let me do the bones first. I've got this big bone here. That, of course, is my femur, or your femur, we could call it that way. And we've got this big bone here. This is your tibia. Now, I'll come back to Laura's image in a second when we look at flexion extension. So femur and tibia. Now, I also want you to realise that the muscles which control the knee, they are above the knee. So I have this one here, okay, and I have this one here. Okay, and the one above the femur, this is what we refer to, I'm sure you guys know this already, this is what we refer to as your quadricep. Now, I'm going to simply leave it as your quadricep here. We're not going to write in the vastus muscles and the rectus femoris muscle because we don't need to touch that for right now. But I'm also going to talk to you about this muscle on the back of the thigh, back of the femur. And of course, this is your hamstring group. And we're going to write it in as hamstrings. Okay, and again, there's three muscles in there: semimembranosus, semitendinosus, biceps femoris. Let's leave that information for now, and let's simply refer to it as the hamstrings. Now, what I want you guys to know is that if my hamstrings contract, okay, look, they're connecting here. When they contract and shorten up in that direction, this moves around here, and this, of course, we call flexion. And when these quadricep, big powerful muscles on the front of the thigh, when they contract upwards in that direction like that, of course they straighten the leg, and that is what we call extension. Okay, extension. So we again have got the notions of extension and flexion at the knee joint. Examples from Laura. Let's have a look. Well, look, we've got a classic here. Here is the arm in a flexed position. How has that been achieved? Well, this muscle, the bicep brachii in the front, has pulled on the radius and has created that movement like that. We could say the same here, couldn't we? And we see here we've got flexion as well. Okay, this time the flexion has been caused by the hamstring group on the back of the thigh, pulling on the lower leg, and of course here we've got extension of the back knee, and the extension has been achieved because the quadricep group has pulled and has straightened that leg in that way. So straightening, extension, bending, flexion, beautiful. Now let's make it a little bit more challenging. Let's look at the shoulder for a moment. Now we're going into, of course, what we would refer to as ball and socket joints. Ball and socket joints. Ball and socket joints. Now I'm not going to get into glenoids, fossa, acetabulums. That's for a later stage of study. But what I would say to you guys at this point with the GCSE PE courses, you're really in what I would call a gateway course. Some of you may never want to take that gateway to anywhere further in the study. That's obviously completely up to you, I understand. But if you do, there's a whole depth of learning that can be achieved here, and you should really consider it. Anyway, there's my little sales pitch. Now, I want to talk about the shoulder. I haven't got quite as much detail in my image to help us out here. In fact, let's go up to, let's just do the shoulder up with Laura here, okay? So, we've got the shoulder here on Laura, and we've got that ball and socket joint in there, okay? And we could also talk about an equivalent one in the hip, or the other ball and socket joint over here. So the first thing I want to say about the shoulder, I'm going to write it up here, I think, rather than down by the image. I want to know the articulating bones. Well, this bone here in the upper arm, we already know, is the humerus. And the bone which it articulates with, and a lot of people want to put clavicle at this point, but the answer is the scapula. And if we come down here, this scapula or shoulder blade. This is the, my scribble is appalling. This is the bone that actually articulates and provides the cup, the socket, for the head of the humerus, or what we call the humeral head, to actually connect together. Now, I personally think that the really interesting thing about this is that we've got a number of muscles which contribute. The ones I'm going to talk to you about is I'm going to talk to you about the muscles of the deltoid. The deltoid muscle really surrounds the shoulder. Okay, and the back of the deltoid is called the posterior, and the front of the deltoid is called the anterior deltoid. And the deltoid muscle controls both flexion and extension. Now, I want to be clear here. If the arm at the shoulder goes back behind the body, we've kind of got that here in this position, we call that extension. Okay, so if the shoulder is back behind the body, it's extension. If the shoulder's if the arm's moved at the shoulder in front of the body, a bit like this front arm, we call that flexion. Again, in the sagittal plane once again, but of course it becomes slightly different, because in some movements we can of course take this humerus, and it's kind of in this line here at the moment, but we can move it to there, to there, to there, and to there, and of course we call that abduction. Okay, abduction. Okay, if we move that same bone back into here, into here, into here, and back into the midline like this, we call that adduction. Okay, adduction, back towards the midline of the body. Adduction would be this way, and abduction would be that way in this particular circumstance. Okay, so effectively like star jumping, as if you're kind of like doing a flapping action with your arm. Now, that's all well and good. Let's have a quick look at the hip. The hip works in basically the same way. You know, it's a very, very similar joint. The kind of differences around the hip to the shoulder are that this socket here is much deeper. It's got some cool words around this. I'm not going to go into them now. But this socket here is much deeper, and effectively this ball here sits in that socket much deeper. So it makes it more of a stable ball and socket joint, but a ball and socket joint all the same. I do find it interesting, again, I'm not sure I'm just going to help us, but I do find it interesting to point out the shape of the top of the humerus to people. You know, it's kind of like if you just look at that little bit that I've kind of like blackened the outline for there, that's a really unusual shape. You wouldn't necessarily expect that from a long bone, right? You kind of just expect them to be like a stick, a straight line, but it's a really unusual shape. So I'd encourage you to reflect on why that might be. I'm not going to cover that in too much detail right now. Now, what I do want to cover is to tell you that if I move my hip out that way, again, I am doing this. I have got a process of abduction. If I move it inwards, I have adduction. Let's see if we've got an example up here. If I have my hip, or Laura has her hip, in front of the body like this, it's what we call flexion, exactly the same as with the shoulder. And if the leg is behind the body like that, it's what we call extension. So now we've got a really nice understanding of all of those movements. Now, one other thing I'd just like to say to you, some of you need to know this, but bear in mind that if we look at the humerus here of the shoulder, this shoulder can also rotate. I didn't mean to choose that colour. Let me choose something different. Hang on a minute. What are my options? So this shoulder can also rotate in its around the axis of the bone itself, and we call that rotation. I'm just mentioning it to you. Some of you need to cover that, some of you don't, but it's called rotation. Okay, it's called rotation. So if you kind of put your arm out and then you rotate the arm, the humerus in the socket of the scapula, the shoulder blade, you can rotate your entire arm. That's what we mean by rotation. I might do it when I come back on the screen in a moment and show you what I mean. But that's what we call rotation. And we do it the same with the hip. It can rotate like this. So just be aware of that. It doesn't rotate all the way around, but it rotates a little. Okay, questions. Now, I've kind of prepped this because I didn't want to spend too much time showing you these, so you watch me write these in. So let me see if I can pop the first batch of answers in here. Look closely at this image and then complete the table that follows. So it's a movement analysis type exam question. So right shoulder, here it is, look. We're interested in this shoulder here. Right shoulder, what movement pattern is that? Well, the elbow seems to be in front of the body, like in a pointing forwards position. That's what we call flexion. Circle tick. We don't get a mark here because it looks like I've got to get both movement patterns. The joint type is a ball and socket. Circle tick, nice. The articulating bones, articulating means that the bones that meet at the joint. Scapular and humerus, correct. The plane of movement, more of which in the second half of this, but we already know it's the sagittal plane, correct? And which is the agonist? The agonist is the anterior deltoid. Anterior means the front, okay, the front part of the deltoid. If we were talking about the posterior, we'd be talking about the back portion of the deltoid. Okay, you probably have got the mark for deltoid there, but I want it to be specific, so why shouldn't we be? Now then, let's go a little bit further. We've got the right knee now, so that's this knee here. Okay, so let's have a look at our answers. We've got here the right knee is in a movement pattern of extension. Now, I had to think about this one because there is a slight bend there. So if you're saying to me, James, that's flexion. Yeah, okay, you might be right. I felt it was more straight than bent. So for me, I went for extension. Now I've got my two marks, my two movement patterns correct, so I get a mark. I'm being super harsh in this question because it's a tough question. You've got to get 10 lots of information for 5 marks. It's a bit tough, really. What type of joint is it? It's a hinge joint. Beautiful. The articulating bones, femur and tibia. Nice, that gets me the next one. The plane is the same, sagittal, more of which in a second, mark. And which muscle causes extension of the knee? Well, it's the quadriceps. Circle tick will mark. I get my max in there and I move on. Okay, question. I've already got my answer in, so let's go through the question. Look closely at this image. Identify the movement pattern of the hips and the plane through which this movement has occurred. Now, again, I had to look at this image. I had to study this image for a long time to decide what movement pattern was happening here. When I first saw this, I thought that this leg was in flexion, and I thought that this leg was in extension. And if I'd answered it that way, I feel I could justify that. But let's be honest, sometimes in an exam, we're going to get a question where the image is kind of, this image of Laura here, but kind of because there's one mark available and it's only asked for one movement pattern, and it really very easily could be abduction, moving the limbs away from the midline of the body. I went for abduction there because I wasn't completely sure, but I felt, if anything, it was abduction. Now then, we've also got the plane of movement. Now, we're going to find out more about this now, so I won't go into too much detail. But abduction and adduction happen in the frontal. Some of you call it the coronal plane. There's my max. And I'm good on those 7 marks that are available in some, well, let's be honest, some quite easy questions, but it's a great place to get started. Okay, so let's make a start on this second part. So we're talking about planes, and it's one of those things where you see the word, it doesn't shout out to you exactly what it means, right? So let's see if we can kind of simplify this. I've heard an awful lot of people suggesting this year that this is a really, really hard topic and people are really confused and stuck on it. So we thought it would be a nice one to include. I'm going to be honest, I don't think it's something to get stuck on. And I honestly, I don't think it's really that challenging. So if you're feeling worried about it, I really don't think you need to be. So let's sort it out one way. Let's sort it out once and for all. So we've got 3 kind of mannequin dummy type figures here, and let's just number them 1, 2, 3. Okay, and obviously we're going to name them from this point forward. So before we get into what these words mean, just accept from me that this is what they're called. So this first one is called the sagittal plane. Can I emphasize the need for you to realize that that is a single G double T? Okay, so that's going to help you out, this sagittal plane, more of which in a second. We have this next one, number 2 here. You've got an option here. Check your exam board spec for this, but you can call it the frontal plane. Some exam boards call it the coronal plane. Okay, I will call it frontal now, but replace that word with coronal as required by your exam board. Okay, and finally, this is called over here the transverse plane. The transverse plane. Okay, so the transverse plane. You might be thinking, okay, fine, there's some words, I can learn them. Now what the hell do I do with this? Well, we use planes for in my opinion, we use planes for one single purpose, and that is this nice simple purpose of describing movement. Okay, now of course at the moment, we're kind of learning that flexion is different to extension, to adduction, to abduction. The funny thing about all these movements that we're learning with sort of one single word for each one is during really dynamic sporting actions, they kind of all blur and merge, and the line between them is very, very slim. So having a planar description allows us to give more detail into how we're describing movement and the combinations of movement. So just take it from me, this can be a very, very useful thing. So first of all, let's look at the sagittal plane. In many ways, it's the one you're going to use most because you do a lot of work around hinge joints and also ball and socket joints. So it's a really, really useful one. So this is how it works. We see here that the sagittal plane cuts the body into left and right. Okay, so we can note that. I don't know if we're going to get any marks for saying that somewhere, but okay, it separates the body left and right. Honestly, that's not the bit I'm interested in. Why I'm interested in it is because if this performer here takes this arm at the shoulder and moves it into a position of flexion, as it's there, for example, can you see from me that that has moved along, or as I like to call it, through the sagittal plane? Equally, if they take that same shoulder and they put it behind them there, you know, like reaching back as if you're sort of grabbing a baton in a relay, something like that. Can you see how that is moved through the sagittal plane in that direction? Hopefully you can see that. Equally, if this performer sort of raised their hip in front of them in flexion, and now their leg was kind of like that in front of them, can you see that all of those movements at the hip and the knee have all happened along that sagittal plane? So the crucial thing for me, and let me write it down here, the crucial thing for me is that the sagittal plane describes the movements of flexion and extension at both hinge and ball and socket joints. So that's the point I really want to get across to you now. Now, for those of you that do study the ankle, you can also address plantar flexion and dorsiflexion this way as well, but I'm not going to cover that now because the majority of the boards aren't looking at the ankle here. So flexion and extension can be described in that way. And again, let me be clear, if this arm flexes at the elbow here, so it moves from there to there, that is also through the sagittal plane. So let's just go back up to Laura a second. Where was she? Right at the top. So this here, this knee, this hip here, at the hip, has moved through that sagittal plane. This slight flexion here at the knee has moved through that sagittal plane, and we're able to describe the movement in that way. Okay, so that's what our sagittal plane effectively does for us. It allows us to describe flexion extension. Now, of course, if you grasp that concept, it's not difficult now to see what the frontal or the coronal plane does for us. Because, of course, if this person abducts their shoulder in that sort of position, can you see immediately that what we've got here is movement through or along the frontal plane? So first of all, we've got the notion of abduction. Okay, it's movement along or through that frontal plane. Okay, and equally, if the arm is moved back down in the form of adduction, we would be doing the same thing. Okay, so start to think about sporting examples of movements where you could describe them in a planar sense. You might even want to start to think about movements that combine, skills and techniques which combine movement from different planes. Trust me, that is not a big leap to take if you understand the concept. It's very, very simple, and you just have to get this conceptually right. Now, the only other point I want to make here is, of course, that the hip can also kind of abduct to some degree, and it can adduct to some degree. It can abduct, so it can go from here in that direction, and it can go from here back in that direction, adduction. Remember, with this one, we are talking about movement in relation to the midline of the body. If we're talking about abduction and adduction, movement to and from the midline of the body. So the frontal or the coronal plane is all about this abduction, adduction. Now, transverse is probably the most testing of these. I want to say testiest. Does that mean what I mean? Does that mean what I mean it to mean? To be testy means to be grumpy, doesn't it? Anyway, that's another story. So the transverse one, I often find when you look at this, it's not intuitively obvious what's going to happen here. But the point I would like to make for you is that if this performer, for example, was to turn their head, like if you could now just, I don't know, wherever you are sitting, I'm going to move away from the microphone briefly here, move your head as far to the left as you, I might have gone a bit quiet there, so twist your head as far as kind of to your left. That is movement along or through that transverse plane. Now another example I'd like to give you, I mentioned it briefly earlier, if we take the axis of the arm for a second, if we are to rotate that arm in this way, that rotation also happens along or through the sagittal plane. Equally, if we take the axis of the leg and we were to rotate it this way, sort of turning our foot out and in, think about sort of different positions that, the positions 1 to 5 in ballet, for example. So that's going to also provide us that kind of movement along and through this transverse plane. So all that in conclusion, the point I'm trying to get to you is that the transverse plane describes rotation. Okay, it describes rotation. So we can now take a sporting movement and we can describe it through planar instruction. Okay, or through analysis and of planes. And that's a really nice skill for you guys to have. Let's have a little look at how some questions might address it. So let me drag you down here. So what have we got here? Barry, I might just make this slightly bigger for you. See if I can do that now. I might regret doing this here. Let me just make this a little bit bigger. Okay, hey, that worked all right, didn't it? So a little bit bigger. So practice questions. All movement can be described by using planes. For the following examples, identify the movement pattern and the plane of movement at the specified joint. Well, okay, I've got the first ones in. I've already answered these for you. So left knee. So this is this knee here. Okay, for our performer up there. This is Sarah, by the way. We're going to look at Sarah's performances some other time. She's a really good quality netball player. So movement pattern, well, the leg is straight at the knee. So, of course, we're going to call that extension. An extension is going to get us a circle. It's going to get us a tick. It's going to get us a mark. Now, we know from what we just said a moment ago that, whoops, I'm regretting it now. I have to start dragging this around. We know that extension is as a result of this, it moves through the sagittal plane. So all flexion extension is through the sagittal plane. I might not do that anymore. I guess it's going to confuse me if nothing else. So we know that sagittal is the plane of movement for that movement of extension. Now we're going to get exactly the same here. This time we've got the neck. Okay, so we've got the neck here. Her head is rotated to look in that direction, something along those lines. So we can call that, boom, rotation. And what we're saying here, we mentioned before, rotation happens through or along the transverse plane. So again, nice, 2 marks there, 1, 2, boom. Right shoulder, so it's this one. Now this is probably the test. Why is it the trickiest? This for me, the image doesn't give me every single possibility of information I could get to be 100% certain of what it's asking me, but I'm making an educated guess. So I'm assuming here that this shoulder here, I'm going to describe this as abduction. Now this is where the planar movement, at the point I made before about combining movements, is interesting, because abduction, of course, if your arm goes out in front of you first and then above your head, it's initially flexion, right, then hyperflexion, and then into sort of an abducted position. And of course we do have that concept, for those of you that study it, of circumduction, which you can use if it's on your specification. Okay, so circumduction is that combination of flexion, extension, abduction and adduction to kind of circle the shoulder or circle the hip. But I'm going for abduction. That was my educated intuition around that joint position, so I get myself a mark there. And of course, as we said before, that is along the frontal plane. Okay, so I now have that frontal or coronal plane, circle, tick, 1 mark, and I've got all 6 of those marks available, and I get my max. Beautiful. Now, although these last 3 questions are super simple, and we started at a really easy pace here with this one in sessions 2 through session 6, we're going to be discussing, evaluating, analysing. We're going to get there, okay? Just be patient. So we've got a command word here of identify, identify, identify. Let me be clear with the concept of identifying something in an exam. For goodness sake, if you are asked to identify via an exam question, do not spend any time doing anything else other than naming it. Okay, I'm going to say that again. If you're asked to identify something in an exam answer, all you have to do is name that thing. Zero, nothing, absolutely zilch else, because the skill is identifying. I don't need to describe it. I don't need to explain how or why. I don't need to give it strengths and weaknesses. I don't need to compare it. None of that. I'm simply saying what it is. Now, of course, I'm being asked for 2 here. So I need to identify 2 movements. So I'm going to say what they are. So let me put the first one in for you. Super, super easy. I'm a bit disappointed with my answer because, of course, I should put a full stop. Come on, James. So identify 2 movement patterns that take place through the frontal plane. Okay, and I've got abduction, adduction. Nice, there's my little Max. Super simple. Identify, I'm going to do nothing but name these things. Often with identify questions, we normally say it is something. But here, of course, we're saying they are, because we're asking for 2. That's all. That's the skill. That's all I have to do. So here again, they are. So my 2 movement patterns are flexion and extension. Beautiful. There's my little Max. Now, this last one, I don't realistically think you GCSE guys are going to get 2 marks for naming rotation. So identify 2 movement patterns that take place through the transverse plane, okay? So I decided, I don't think in reality you're going to get a 2-mark question for this. You're just going to get a mark for saying it's rotation in reality. But I decided just to go a little bit further with it. And I said they are, same skill as before, medial and lateral rotation. Okay, so I've got my medial and my lateral rotation. So I get 2 marks. If you're not bothered about using the words medial and lateral rotation, I don't blame you. I probably wouldn't use them in a GCSE exam either, but I kind of made this question that way, so I had to put something in. But the key point is this rotation point, okay? This rotation point, okay? Rotation happens through or along that transverse plane, and as a result of that, we can describe movement in a much more coherent way as a result. Okay, I'm going to switch off from the canvas here and come back to speak to you on the camera. A few moments, please. Okay, short-term effects of exercise. Now, the first point I want to make is that if you are studying on any exam board other than AQA, short-term effects of exercise means anything which is not long-term, such as what happens immediately when we start exercising, and kind of in the in the time period of kind of like the exercise zone. The reason I'm mentioning that is because if you are an AQA student, you separate this into 2 considerations. One is the immediate effects of exercise, and the other is the short term, or 24 to 36 hours after exercise kind of period. So this here is for anyone studying AQA. You might think about separating your short-term effects into these 2 groups. And I think it's important. Everyone else, these 2 groups are effectively unified, okay? And we consider this to be the same thing. So just be aware of that. Secondly, we're talking about the short-term effects of exercise basically on the human body. Okay, so the way we need to deal with such a kind of a huge topic, I mean, it's gigantic, is we're going to analyze it. We're going to break it down into system-based chunks. But one of the things I'd like you guys to realize is that when I talk about skeletal in a second, please realize it's related to the muscular system. These are not separate entities. These are unified, or at least they're corresponding and adjacent considerations, and they influence and affect one another, which we'll see right from the start. So I think it's important to clarify that point. The other thing, before we sort of really jump into this, I want to repeat that we are going to push you hard in this session. So I'm going to be specifically using good quality language. Specifically, we're going to be pushing you to write really good quality answers. If you need to use our DVR and drag back and take things again, and take longer than the whole hour session, then do that, okay? There's nothing wrong with that. You might need to do that. Okay, all that being said, let's get on with it. I want to initially address what I would consider to be the skeletal impact of exercise. the effect of exercise, I should say, on the skeletal system. And we have Julie here, and of course Julie is participating in the sport of netball, which combines sort of both aerobic and anaerobic work within the performance. So it's kind of interesting from that perspective. Now, the first things I want to talk to you about is that, and I think this is a super important point, one of the key things we need to grasp hold of is that when we start exercising, we produce extra levels of synovial fluid. So reflect for a second what synovial fluid is. It is the gel-like innards of a synovial cavity within a synovial joint. So let's take, just for argument's sake, let's take Julie's shoulder joint. The synovial fluid is going to increase, first of all, it's going to increase in production, but we're also going to get that increase in temperature within that joint generally, but specifically within that fluid. And as a result of that, we are going to get a decrease in synovial viscosity. Woof! What a description. Now, synovial viscosity means that this increased production of synovial fluid, which is now warmer within the muscle, becomes kind of looser and more fluid, less sticky, if you like. It becomes less viscous, less sticky. And what is the overall impact of that? Well, all of that means that Julie, at her shoulder and other joints, experiences an increase, or let me say an increased ROM, an increased range of movement at the joint. Now, I think we'd all agree that within exercise conditions, having an increased range of movement is a really significant point, because it effectively allows us to complete full ranges of motion at the joint. It allows us to apply force over a longer period of time. It allows us to be technically correct in our performance if extreme flexibility is required, beyond the points that we can reach for things. We can take high rebounds, this kind of stuff within the netball environment, but never. All of that means that we're going to get a better quality performance. So we're really interested in these sorts of notions. Now, if we were to look at that in combination, remember we are doing it in combination with the muscular system, we'd also notice a few things there. Look at this combined point. We get an up arrow, I'm not going to write increased anymore, an up arrow of muscular temperature. So temperature influences both the skeletal system and the muscular system. What are the impacts of this? Well, look, we get an increase, dodgy arrow, James, we get an increase in contractile force. So this increase in temperature means that the muscle fiber, this muscle, which is made up of lots of hair-like fibers in the muscle, it's able to contract inwards with more force. It's able to contract inwards with more force. So on that basis, with more force, sometimes I try and rush too much, with more force. So if this muscle is contracting with more force, of course, what does that mean for us? It means that tendon end there and that tendon end there are effectively applying more force onto some bone somewhere that's going past. Okay, so these bones at either end are experiencing more force application. If they're experiencing more force, then of course our movement is more powerful, stronger, speedier, faster, these sorts of notions. So that increased contractile force is really, really significant from our performance. We'll also say that because of our warm-up, I think I've got a different colour, let me change, we get increased flexibility. Sometimes I've seen the word extensibility, increased flexibility of muscles, which if we go back to the point we made before, where am I, increased ROM, then of course we're talking about a muscle and being able to move a joint through a greater range. And as I said before, that's going to increase our technical performance and allow us to perform at a better level. Excuse me. Now, we also get things like increased CO2 production in the muscle. Increased CO2 production. If guys, increased lactic acid production, especially during anaerobic work. The CO2 production is during aerobic work, of course. Increased lactic acid production. So these things begin to happen within the muscle. Now, run out of space. What that could lead to is experiences of fatigue. It could lead to obla, depending on how much of this work here that we actually do. But those are possibilities for the effects of exercise on the muscle. So it depends on those factors, okay? So we've got increased temperature, increased contractile force, we've got increased flexibility, we've got more production of CO2, which of course is aerobic. I'm not going to get into where it comes from, but just let's accept that for now. And we get increased productions of lactic acid, especially for any higher intensity anaerobic work, which can lead to fatigue and the onset of blood lactate accumulation, that point where blood lactate increases rapidly because we're doing too much anaerobic work for it to be sustainable. So all these muscular effects take place. Let's have a little look at cardiac for a second. So we have got things such as, excuse me, we have got, for example, up arrow, an increase in SV. Remember that SV is stroke volume. One of the things we'd encourage you to remember is that cardiac output equals stroke volume times heart rate. Okay, so of course, during exercise, it's often the case that we want to get this cardiac output up. Okay, so of course, if we experience an increase in stroke volume, that is going to be beneficial towards that end. So an increase in stroke volume. Now, you might ask yourself a question, well, why is that? Why does more blood leave the left ventricle per contraction? And there's a very basic answer to that. There's more blood arriving back at the heart. That's the main reason. And beyond that, the heart is being stretched further. And of course, when a muscle, in this case, the badly drawn heart muscle, oof, that really does have a big left side. When this muscle gets filled up more and it stretches because it's fuller, okay, it stretches out because it's fuller, of course, think about what's going to happen then to anything that's elastic when it contracts back in. Actually, that downwards is only in the atrial systole, but anyway. So imagine you're going to get that increased force. So therefore, we've got more blood coming back to the heart and we've got a greater amount of blood leaving the heart because the heart is stretched and boom, pings back with more force. So it's a nice little thing to remember. So we've got increase in stroke volume. Really, really important. We also, of course, and we all know this, we get an increase in heart rate. Our heart goes from being something like 60 to 80 beats per minute at rest, and for you guys it can go as high as something in the region of 205 beats per minute. So of course we're getting a dramatic increase in stroke volume if we go to maximal exercise conditions. So therefore that is a significant change. We also need to think about the fact that we get therefore an increase in cardiac output. Now for those of you that do like symbols, just be aware that you can, if you really want to, you can refer to cardiac output as Q dot. It must have a dot above it like that. But generally speaking, I don't use that with GCSE students. Not totally sure why, but you can think about it that way. But what we certainly get is we get an increase in our heart rate, an increase in our stroke volume, which has the a product effect of having an increase in cardiac output. Now, just if it's helpful, cardiac output can go from as little as 5 litres per minute of blood leaving the heart to typical figures around about 28 litres, but you can get even 30 to 40 litres during maximal exercise with really good athletes. So that increase in cardiac output is really, really, really significant. Now, let's have a little look. I'm going to jump down here to the right-hand side. Let's have a little look at some vascular stuff. So vascular, just remind yourself, means the blood and the blood vessels. That's what we mean by vascular. So let's have a look at what we're talking about here. First of all, we get an increase in blood pressure. So blood pressure goes up. Now, when we say that, it sounds a bit like it's negative. Oh, high blood pressure. But of course, in this sense, what we're achieving is that the blood is working against any kind of resistance it might have and being delivered more frequently, more, and we'll see in a second, more accurately, but in greater quantities to where it's needed. So that blood pressure temporarily during exercise helps. And the one thing you might want to be aware of is it's particularly the systolic blood pressure which increases. Secondly, we get redistribution of blood. Redistribution of blood. What do you mean, James? Where does this blood get redistributed to? And I'm going to say of cardiac output. Let's be correct. Redistribution of blood leaving the left ventricle per minute. So obviously, as we're sitting here at rest, it's probably slightly different for me because I'm a bit tense. I'm kind of on show here a little bit. But when I'm sitting here, very little, about 15% of my blood is going to my kind of skeletal muscle, my quads, my calves, my hamstrings, for example, my deltoids, other than to keep the tone of my body in my human shape, roughly. But of course, that 15%, if I start exercising, my body has a capacity to fire more blood to, for example, my quads if I start doing squats, say. And that is called the redistribution of blood. And you can call that, if you want to, vascular shunting. Okay, vascular shunting. And I hope you guys are aware that that is achieved because basically our arteries, there's a little artery, they have a little lining in them of smooth muscle. And well, actually it's more than little, to be honest. But that smooth muscle can either constrict inwards this way, or it can dilate outwards. And of course, if it dilates outwards, say to my quadricep muscle, it means more blood is going to pass through that channel. And as a result, more blood is going to get to my muscle during exercise conditions. So we redistribute that cardiac output to the working muscle. A couple of other points that are really important on the vascular side. A couple of other points. We get a decrease in blood viscosity. Remember that word I used before for the synovial fluid. My blood becomes less sticky, and because of that, it flows better. Okay, and basically the reason for that effectively is that the temperature increases. Okay, so it's basically a temperature thing, which causes that, which is actually really useful. Notice here I'm not putting down more hemoglobin, growing red blood cells, because this is short term. This is what happens during, not as a result afterwards in the adaptation process of the training. Now, respiratory, let's put a couple of points in here, please. First of all, we definitely get an increase in tidal volume. Remember, tidal volume is the quantity of air breathed in and out of the lung per breath. So if we increase that tidal volume during exercise, it means I go from this, I get really close to the microphone. This is kind of normal. That's my resting tidal volume, about 500 milliliters if you're interested. This is my max exercise tidal volume, or if I do what's called a forced breath. I hope that was as unpleasant for you as it was for me. But you see, my tidal volume went up as if I was in exercise conditions. Okay, I'm doing what's called a forced breath, but exercise has the same impact. Now, we also get an increase in breathing frequency. Now, breathing frequency simply means how many breaths you take per minute. Now, at rest, we don't really talk about that in Gcse, but in rest, it can be between about 8 and 14 breaths. 8 to 14 breaths is pretty typical. And it's actually something we don't really pay a lot of attention to, breathing rate. But of course, that's going to go up to during exercise conditions. So breathing frequency goes up, and that's useful for us to know. Okay, increased breathing frequency. The other thing is we get an increase in breathing depth. Now, I think I've already made this point, because increase in breathing depth and tidal volume are effectively the same point. But as a result of all of this, we get an increase in exchange of gases. Now, a couple of things I want to mention about this. Okay, how is it that our tidal volume goes up and our breathing becomes deeper? How is it that our breathing becomes faster? And I really want to mention this. We get the activation of respiratory muscles. So in the case of the diaphragm, for example, the intercostals, they're already working now as we sit here, we're breathing in quiet breathing or resting breathing, but they become more powerful during exercise, or they contract harder during exercise. And we also recruit other muscles. Now, I'm not going to get into mechanics right now, but we recruit other muscles to further power and speed our breathing depth and rate. Okay, lovely. All right, let's have a little scroll down here. We've got a question. Let's take our time. Let's make sure we do it good quality. I've put the answer in already, but let's make sure we do it well. So it says here, explain how. So before I get into anything about the question, I know I'm going to be using terms such as through, by, because. This means, note the capital. I'm going to be using therefore, comma. I mean, I might not use all of these, you understand. therefore, comma. These are the things that are going to structure my response, because that means I'm explaining. So let's see what it's about. Explain how the respiratory system responds to the onset of exercise. So look, it's about the respiratory system. If I write a beautiful answer about, say, this, how many marks am I going to get? 0, because I have to pick out that word respiratory system. So let's have a little look. First bit first. This happens, note my little by, this happens by the increase in strength of respiratory muscle contractions. So respiratory, as I was just saying, muscle contractions, they increase in strength and get me a mark. And maybe I get a mark for saying diaphragm and intercostals, maybe. Let's be generous, okay? But maybe that's the same point. So I'm saying that we get a greater strength of contraction. Next point, here we go. This means, oh look, I'm explaining how. This means that tidal volume, and that combined with, I've missed a word. Tidal volume, this should be increases in there. Tidal volume increases, and that combined with increased frequency of breathing. So I've got increased frequency, I've got increased tidal volume or increased depth. And then we've got this notion, we've got minute ventilation increases. Now, just let me go to the side here. If we take tidal volume, which is how much air we're breathing in and out of the lung, and we multiply it by frequency, how often we're taking those breaths, that equals what we call minute ventilation. Minute ventilation. So it's a nice term you can include in your answers. And what I'd say here is some of the examples use that term and some don't, which is why I'm kind of using it tentatively in this environment, okay? But tidal volume times frequency, it's a bit like the cardiac output point for the cardiac stuff, leads to minute ventilation. So of course, if minute ventilation goes up, we're basically saying there's more air available for gases exchange. But importantly there, I've explained only about the respiratory, and I've got enough in my answer to get me the mark. Now, this next question is really interesting. By the way, let me mention the DVR thing again. If that's too quick for you, just drag, in terms of this live stream, you can drag me back. Okay? So if you need to, do it. No problem at all. So, identify. We've got a different command to explain how. Identify. Now, when I say identify, it's kind of like I'm really in the area of just saying what it is. I'm not saying how. I'm not saying why, I'm just saying what the answer is. I'm naming that thing. Identify 2 immediate responses to the cardiac system to the onset of exercise. So 2 things first of all. I'm asked to identify, and I'm only going to get marks for my first 2 answers. If the number 2, or I don't know, the number 3 is named in your answer, or in your question, they're going to mark your first 2 or 3 responses. So make sure they're right, please. Here we go. I missed a little bit at the end of my question. There you go. I won't go over that. You can see that I've already mentioned it. Therefore, total air available for gas exchange increases. And I've made a mess because I wrote 2 or 3 up there. Sorry about that, folks. Right. The first thing I'm identifying is, and really when we're doing identification, all we have to say is what something is or are. The first is stroke volume increases. So there's my mark. Stroke volume increases. I just have to name it. That's all I have to do. I don't have to say why. I'm just identifying. And the second is that heart rate increases. Thank you. There we go. Okay, so I get my 2 marks. Note I haven't described. Note I haven't explained. Note I haven't evaluated. Why? Because that's my command. Okay? And therefore it allows me to move on quite quickly. Now, again, your teacher might want to put that in for your exam board in context of A1-ness. Have a chat about that, okay? So, next question here, we've got explain why. So again, I'm going to have to do more here than I just did, aren't I? Explain why cardiac output is greater during exercise conditions. So why has cardiac output gone up when we exercise, okay? So I've got to be, again, going back to my terms from before, especially because this means therefore, comma. Let's see if I use them. Again, if you need to drag me back on the DVR, do it. Here we go. This is because, look, notice I'm not saying cardiac output is greater during exercise conditions, because don't bother, don't waste your time. This is because I'm answering. This is because cardiac output equals stroke volume times heart rate. Okay, meant to use red there. So I've kind of defined my terms, first of all, give myself a mark for that. By heart rate increasing and through increasing stroke volume, so I've got heart rate increasing, increasing stroke volume, total cardiac output increases from approximately 5 litres at rest to as much as 30 to 40 litres during exercise conditions. Now I've already got my 3 max, look down here. But again, I've given as much detail. And one of the key things I would say to all of you when you go and sit in this exam and anything else, right, this 5 litres to 30, 40 litres thing, it might be at the very upper echelons of kind of, in inverted commas, what we need to know. But here's my question to you as a student. If you know that, why would you leave it out? If it's correct and you know it, why would you leave it out? There are cases where you're asked to simply identify, so that's the skill you're going to perform. But this one, right, I know it goes from 5 litres at rest to a big number during exercise. Why wouldn't I include that within there? But I've explained that cardiac output is a product of stroke volume heart rate, and that heart rate and stroke volume increase. I get my mark. So look, we've got a really nice picture of what it means when we start exercising. Now, just a couple of other points. If you are on AQA board, don't forget to talk about DOMS in your 24 to 36 hours after. You can also get some credit for talking about the recovery process and the removal of lactic acid, okay? So just be aware of those, but I'm not going to go into those. I'm really focusing on this immediate effects of exercise, but you guys can, of course, go and talk about that if, you know, within that context. Okay, so let me sign off on this little section, and we'll carry on the rest of the session. And we are back. Doesn't this seem familiar? So not much has changed here apart from the first word, long-term effects of exercise. But we are in a completely different world in terms of our assumptions and what we're trying to understand. We are talking here about the adaptation process. Get it clear in your mind that that's what we are talking about. So when I think about the concept of adaptation, I'm thinking about something which is, relatively speaking, permanent. Yes, I know that reversibility can take place. We're talking about something, as we know already, which is long-term. But we're also talking about something that happens in the recovery period. So get that clear in your mind. Our fitness changes, our cardiac changes, our vascular respiratory changes, they happen. Why? Because we've given ourselves enough rest and exercise to allow that process to take place. And I can't emphasize strongly enough that that is a really important distinction for you to make, especially in your own kind of, how would I word it, including your own application of these principles to your own training. Okay, that being said, let's get on with it because we don't have a ton of time. So skeletal, we might think, right, well, what happens in the skeletal system? It doesn't change that much. Bones are bones, right? But we do get some changes. Now, we get an increase in bone density. So we can often say we lay down more calcium in the bone and it becomes stronger, thicker, more dense. Now, we're not going to get into the process of osteoblasts, osteoclasts, and osteocytes now. You can look forward to that at A level. However, what I would say to you now is that this has a health implication. We have decreased chance of osteoporosis, osteoporosis, which means kind of brittle bones. And if you exercise over the course of your lifetime, this is something you are less likely to experience as you age, or indeed, you know, before you're aged, I suppose it could be. But that's a really nice one. Now, in terms of muscular, we want to note some obvious things. We're going to have, Laura in this case, we're going to have increases in concepts such as strength. Okay, so the muscular system is going to become better able to provide contractile force. Okay, contractile force. By the way, I said Laura before, that's our gymnast. I should be talking about Kate here, I apologise. So we get increases, that's an arrow, believe it or not, not a tree. We get increases in strength, and we must be able to say there that that is because we get things such as increased contractile force. Let me actually put that in there, increase contractile force. Okay, so that's a nice one for us to include in our answers. A couple of other things that I think are nice for us to be aware. We are able to delay fatigue. So our muscular system becomes better able at delaying processes such as obla. Okay, so that is going to mean that we can work at higher intensities aerobically and be able to work at higher intensities before we get too tired to actually to have to stop what we're doing. We also get muscular, let me change that, got a lot lost there in my thinking, muscular hypertrophy. Okay, so we can't even say the cross-sectional area of the muscle becomes bigger because the muscle increases its size and number of muscle fibers and fibers within the muscle fiber. Now let's talk about cardiac a little bit. So a couple of key things for me here, long term. We get a down arrow reduced, I'm just going to call it RHR, resting heart rate. So of course what we find is if we were to look at average figures, we often say 60 to 80 beats per minute, but a really high quality aerobic athlete may move into something which is less than 60 beats per minute. Okay, less than 60 beats per minute. That has a cool name called bradycardia, but I think the concept is the most important thing right now. We also get an increase in heart muscle size. Now I'm assuming you're all screaming at me, say, James, this is called hypertrophy, a bit like I mentioned it before. Okay, hypertrophy. It is. When I think about this, I use one of two terms in my mind to distinguish it from this, even though it's the same concept. So I use the term cardiac hypertrophy, which obviously is related to the heart specifically and the cardiac muscle. If you want to get way jargony, then you can use the term myocardial hypertrophy. But hypertrophy is our key word, okay? Hypertrophy is our key word. Now, next point for me, really important in here, we get an increase in maximum cardiac output. And I just want us to think about this for a second. So if we go back way up here, I said to you a bit earlier, where's it gone? I said to you earlier on that cardiac output equals stroke volume times heart rate. So what are we saying here in the long-term adaptations? Well, we're saying that our resting heart rate has gone down, which means that the athlete has a greater range of heartbeats available during exercise, and it means that the muscle size has hypertrophied. And of course, what does that mean? It means an increase in stroke volume. So as a result of that, the potential for us to have a high cardiac output is much better. So this number I mentioned here, perhaps here, we can get nearer to the 40 rather than the 30 because we have this training in place. Increase maximum cardiac output. Okay, we're almost there. Respiratory system. A couple of key points. There's nothing I think going to shock you here. I don't think we're going to have decreased resting breathing frequency. So have a think about that for a second. That means that as a result of long-term training, the number of breaths per minute I take at rest is going to decrease. Why is that helpful for exercise? Because it means I've got a greater range of breathing rates when I start exercising. So it's important from that perspective. And the reason that happens, of course, is because I'm getting an increase in tidal volume, the amount of air I'm breathing in and out of the lung per breath. So that's really important. And I get an increase in maximal, during exercise, minute ventilation. So during exercise, because I've trained, I have a better capacity to draw air in and out of my lung, which of course means I've got more capacity to increase gaseous exchange amongst other things, okay? So my maximal minute ventilation, how much air I can breathe in and out of my lung per minute, increases at that maximal level. And we're saying maximal level because of course your minute ventilation at rest is basically the same whether you're fit or you're unfit. It just varies whether we have a higher or lower tidal volume, and whether we have a higher or lower resting breathing rate. On the vascular side, Oh, I apologise, folks. We also get an increase, and I'm going to use two terms here because different exam boards use them differently. We get an increase in what we call functional lung capacity. So that's, literally how much air we can breathe in and out in a maximal breath. And just be aware that some of you call functional lung capacity vital capacity. So just check with your teacher which is the correct term for you, okay? But it's basically the same point, vital capacity or functional lung capacity, because we've trained. On the vascular side, to finish this off, we get capillarization. Okay, capillarization. This is the growth of new and thicker, more dense capillaries at the alveoli, so at the lung basically, and muscle. So we get more capillaries available at the lung, the alveoli, and the muscle. We also get stronger, smooth muscles. So that, remember those smooth muscles I talked about earlier, which are the ones that are within the arteriole. These muscles get stronger. What does that mean? We're better able to redistribute cardiac output to where it's needed. Okay, so stronger, smooth muscles, so we get better or improved redistribution or vascular shunting. And I should have said at the start, actually I should have said over here, folks, on the respiratory side, we get stronger long-term, not just in the contraction, stronger respiratory muscles, which of course is why our tidal volume would actually go up. Okay, so we've got a range of adaptations there which are going to power an increased aerobic and, in some cases, anaerobic performance. Now, this is where it gets meaty. Let's have a look at this question. Discuss. There's some people out there today who are terrified of this concept of discussing. And of course, what we're also saying here is that we've got maximal marks available, depending on your exam board, how many marks that is. But discuss the effects of high quality aerobic training on the human body. Two things for me before I partly answer this question. So what I'm going to do with this question is I'm going to answer, if you like, the first 2/3, and then I'm looking forward to receiving you completing the answer in a completed format. So first of all, let's take the concept of discuss. What does this mean? Well, it means we have to decide what skill to show. I could, for example, evaluate, okay, which means strengths and weaknesses. But the problem with that is I've been told that the quality is the training is high quality, so maybe there's not that many weaknesses to evaluate. I could analyze. Analyze means I break it down and explain it, more of which in a second. I could potentially compare. How does aerobic training compare to anaerobic training? But I haven't been asked that, so that doesn't look to be the one. I could explain, saying how, why, what. That seems relevant, and I didn't quite fit it in here. But I could also describe. I could say what the characteristics or composition of this thing is. So I've got to choose which behaviour I'm going to undertake in this discuss question. The other thing here is I've been asked about the human body. Now, that's quite a macro concept. The whole body? Don't you mean, question, these different systems? These different systems? So, of course, what we're leaning to in this answer is we're leaning to an analysis. We break it down into different systems. We connect them up, of course, and we explain it. The other thing is I feel, looking at the question, I need to describe what high-quality aerobic training is. So let's have a look at it. Let's go through it almost sentence by sentence. Let me show you what I did first. Let me show you what I did first. Okay, so notice here I'm going to go into describing mode, okay? Because I've got this term and I want to say what it is before I go any further. Now we know we don't get circle tick 1 mark for these answers. We get a leveled answer. So let's go through it. High quality aerobic training is characterized by, so look, I haven't done an introduction. I'm just saying high quality training, aerobic training is, and it's this thing coming up, continuous and fartlek training. Now I know some of you do HIIT training. I know some of you do aerobic intervals, but I'm going to stick with those two because it's united across all the boards. At an intensity of 80% heart rate max. Note that I'm not saying 60 to 80%. Why? Because this is an athlete. This is kind of nearer that fat burning range. So I'm up at this 85. It could even be plus 88 at this 80. Sorry, it could even be up to 85. But an intensity of 80% heart rate max for between 30 and 120 minutes. Now just reflect on what I've just put in there. I've just done the FIT principle. I've got I've got type, I've got time or duration if you're on the WJEC or Eduqas board, I've got intensity, and I've got frequency. I've quickly characterized my high quality aerobic training by using my FIT principle. Even though it's not in the question, I'm just saying what this thing is. Then I'm going to go on. Now what I'm going to do is I'm going to start analysing. I'm going to break this human body down into parts. So what shall I start with? Let me do the respiratory system first. Let's have a look. Firstly, comma, and by the way, that comma should be there. Expect yourself to use it. The respiratory system experiences hypertrophied muscles such as the diaphragm, which in turn causes increased tidal volume and functional lung capacity, or vital capacity. Don't forget, you might need to use that term. This means increased quantities of oxygen for exchange. I'm starting now to explain how the body responds to this training. And I've done the respiratory system first. What's going to come next? Let me think. Let's say I'm going to switch now and I'm going to have a look at vascular. Okay, vascular. So now I look at my next sentence and look what I've got. Secondly, comma, the comma matters. If you write secondly, firstly, thirdly, finally, ultimately, whatever, it has a comma after it at the start of the sentence. Secondly, the vascular system adapts capillarization. I should have said capillaries there. Capillarization at the alveoli, and I've got muscle there as well, through the growth of new red blood cells. I should have put that up here. How could I have forgotten? More red blood cells, which means, of course, more hemoglobin. James, how could you have forgotten something so pivotal? Therefore, comma, there is more hemoglobin to carry O2 and oxygen. Moreover, comma, smooth muscles become stronger, vasoconstricting and dilating, and cardiac output can be distributed to where it is needed. So I'm getting all of my adaptations down. Now, what system am I going to look at next? You guys could choose any system you want that I haven't covered. But what I'm going to do now is I'm going to switch to cardiac. It seems to feel like the right time. Cardiac, I could do muscular, I could do skeletal, but cardiac. Let's put our little bit of answer in here. Thirdly, comma, the cardiac system changes by a decrease in RHR. Now, I'd encourage you to write resting heart rate in your actual answer, but a decrease in resting heart rate and an associated increase in stroke volume because the heart has hypertrophied. This means greater cardiac output leaves the heart. Now, you notice here, I've put ... Why? Because I want you guys now to finish this answer off. Okay, I've filled my bit of spacing, but I wouldn't stop there, obviously. I want you guys now to finish that answer off. How would you go through? Now, you might say to me, well, James, I need to evaluate my answer. This question doesn't encourage evaluation. The only thing you might want to think about with evaluation here, one weakness could be that we might have too much weight-bearing exercise. We might overtrain, not fulfill the principle of moderation, for example. Okay, so we might overtrain, for example. Those could be weaknesses, but assuming that isn't the case, what we need to do here is we need to break this concept down and we need to explain it. Okay, and that's what I'd like to think about. So I'm really intrigued to see which of you put magnificent answers in and submit them to us to make sure that we get a really great example of this to complete. Now, I guess a health warning here. I've presented that model, I think, to 7 different exam board specifications, potentially looking at a question like that. Can I make myself clear to everybody that this is coherently a completely solid answer to that question if we interpret the discuss to be an analyze thing, which is ultimately an explanation. Okay, so get that clear in your minds, please. We're doing this. If your exam board say that when they say discuss, you must evaluate, because there is one that does that, obviously evaluate, because they're saying to you, you must evaluate, even though we don't put that in the question. Interesting. But if they say that, then of course you've got to follow that remit and you've got to do that. What we're trying to provide here is a picture for teachers and for students of what a high quality answer would look like if we take the question as high quality too. And that's what we're trying to do. And we are ready to go. Let's go straight into this session on fitness testing. And a little bit more than just describing a couple of fitness tests to you. A couple of points I'd like you to be aware of. First is I've selected 4 fitness tests which are universal to all of the exam boards. So if this is on here, it's on your exam board basically, unless you're doing some very odd Gcse that I've never heard of, okay? So on here, we're going to talk about these. The other thing that I want you to be aware of is I want to go over with you the protocol, how you do this actual test or how you do these tests. I'm also going to go over with you an evaluation of each test, looking at strengths and weaknesses. And I'm also going to go over with you what I'm going to call V, R, and P. Validity, reliability, and practicality of these tests. Okay, so that's very much in my frame for what I want to achieve within this quick session. Now, that being said, let's make sure we realize we're looking at 30-meter sprint, vertical jump, sit and reach, and the Illinois agility test. Okay, now remind yourselves that this is not an exhaustive list. Some of you have to look at multi-stage fitness test. Some of you have to look at Harvard step test. Some of you have to look at Anderson wall test, ruler drop, blah, blah, blah. You have to address those too. I'm covering these four, I should say, within this session. Okay, on that basis, let's get on with it. I want to address, first of all, 30-meter sprint test. Something you're going to hear me say every single time is part of the protocol is that athletes are going to warm up. Okay, they must. Secondly, notice for this 30-meter sprint test that we have a 60-meter track. What do you mean, James? Well, we have our start line here. Okay, we have our start line here, and we have 30 meters in which the athlete can effectively accelerate to top speed. Okay, but that is not timed. The timing starts when the athlete gets to this line here, and it ends when they cross this line here. So recognize the athlete is going to be running at full speed when they arrive. How would we describe that in an answer? So we want to look at something like A to B is acceleration, not timed, of course. A to B is acceleration. Then what we've got is the notion that we want the athlete to be flat out, and I mean fast, flat out speed from start line. Flat out from start line. Okay, so when the stopwatch begins, flat out from start line, when the stopwatch begins, when the athlete crosses this line, the athlete is running at terminal velocity, okay? So we also say flat out from start because they're going to accelerate in that 30 meters as fast as possible. And of course, what we're saying therefore is that B to C, you notice B to C, so line B to line C, we have got top speed, okay? So if we consider this to be line A, this to be line B, this to be line C. So from A to B, we've got acceleration flat out from line A. From B to C, we've got top speed, okay, here to here. All right, nice. A couple of other things. We often call this a rolling start. Try and use that language if you can in your descriptions. Rolling start means that you accelerate from A to B before the timer actually goes. Another point we want to make is that we time the torso. So think of the torso as the chest, the thoracic cavity, crossing this line, and this line for that matter. That's when we start and stop the clock, not when the leg or the foot or the knee. No, when the torso crosses the line. Other points we want to make is that there is a 50-meter version. There's also a 35-meter version of this test as well. All right, so just be aware of that. You might see that in some texts. Might be worth you knowing. And the other point I would make is that you need your assistant here to be the starter and the timer. And what that often means is that we need 2 people. A starter, who's often at this position with their arm in the air, a starter and a timer. So what we might find is that the timer is actually on the finish line over here, and the starter raises their hand and drops it the moment the torso crosses the start line, indicating to this person to start the watch. Okay, so that's nice and useful to know. A couple of practical things. What equipment do we need? Well, we need a tape. Okay, we need a tape as in a measuring tape. We need cones. We need stopwatch. Yeah, I mean, you could argue properly calibrated stopwatch, I suppose. And importantly, we need a flat surface. Okay, and that flat surface, of course, needs to be at least 60 meters, but in reality, it needs to be far longer because you need some kind of runoff at the end. Okay, so you probably need a 100-meter space or at least a 70, 80-meter space within there. Now, we would argue that this test measures whole body speed. Okay, get that clear. It measures whole body speed, okay? It's not measuring finger dexterity and finger movement. It's measuring running speed, whole body speed. We like the test. I haven't really left myself enough space for this. I need to plan this better in future. Let me put my strengths in here. We like this test because it's simple. This is one of its strengths. We like this test because it's whole body. Okay, we can give kind of a whole body impression of speed. And we like this test because it's reliable. What do we mean by the R? Well, the reliable means that the results are consistent if we test more than one time. We get repeatable results. Also in the sort of the genre of reliability is we can compare these results to standardized data. Now, on the negative side, we got some issues of validity. Okay, what do we mean by validity? It measures what it claims to measure. So this is, of course, the issue here is that it's a whole body. Okay, why is that both a strength and a weakness? Well, it's a weakness because it doesn't really give an indication of speed for those that only use a part of the body that needs to move fast. Think about a fast arm in table tennis, for example. Yes, they need to move sideways and they need to run a bit, but it's a different kind of speed. We'd also say it's running specific. We're going to hear this one quite a lot, running specific. So this is not going to be a really good test of speed for a swimmer, for example. And we've got an issue that different people run on different surfaces. So that is a variable which can change, which undermines the validity of the test. So let's come back. We've done the protocol, we've evaluated, and we've looked at validity, reliability, and practicality. Practicality is this point here. It's simple. We could even say it's free almost. It's cheap. Very, very simple to do. So that's a very practical test as long as you've got some outdoor space. Right, let's move on to vertical jump test as I chuck one bit of paper out of the way. The vertical jump test. So let's go through the protocol first of all. It's what we always have to do. So in terms of the protocol, what am I going to say first? Guess what? The athletes must warm up. Okay, that is really important that that does happen. Secondly, we want the athletes to stand. Let me just do that different. Stand. My handwriting. Let me concentrate a little bit. Stand side on. What do we mean by that? Well, the athlete is going to measure. They're going to measure what we call their standing height. Okay, so they're going to measure what we call their standing height. So the way this works, and we're using actually on the image here, we're using what's called a Vertex machine, which is not always available in things like schools and what have you. But when we measure standing height, this athlete here is they're going to stand against this wall, and they're going to stand side on. Let me write that down for you. They're going to stand side on. And what they're going to do is they're going to reach their arm above their head, and the athlete, with the help of the assistant, is going to measure a standing reach height. Let me write that in for you. A standing reach height. Okay, so let's say that for argument's sake their standing reach height is here. They can mark that with a piece of chalk, or they can mark it with a piece of tape, whatever. Okay, so that's going to go on there. And what's going to happen? So let me just put that in. Mark point on wall. Mark point on wall. And then, of course, what we're going to get to here is that the athlete, sideways on, is going to jump as high as possible. Okay, jump as high as possible. And effectively what the athlete is going to do is they're going to jump up here, and they're going to mark a second line somehow onto the wall, because they're going to hold a piece of chalk or something along those lines. They're going to reach up here, and then what we become interested in is the distance and the difference between these points. There's going to be some X centimeters of difference between those points, and that's going to mean that we have a reading of a vertical jump. Now, a couple of things. Therefore, we are measuring a distance, so measure distance, and it's the difference, of course. And the other thing you might find really useful to put into your answers, I really left myself space to put this, the thing that you find really useful is that we record the best of 3 jumps. The best of 3 jumps. So you have 3 goes at this, and you record the best jump possible. Now, a couple of things. This test, first of all, measures power. Okay, so it's a measure of power. Or we can say it's a measure of elastic strength. Only some of you use that term. It's very closely related to a concept of power. But what we also want to say is that we've got certain equipment to use. So in terms of equipment, we've got the following. We need a perpendicular surface. James, what do you mean? Well, we need a surface where the floor is at right angles to the wall. Okay, so we need a perpendicular surface. We need chalk or equivalent to mark the wall. We need some kind of meter rule or tape to measure the distances. We need a clipboard because we're going to, and paper and pen obviously, because we're going to note down, you see that here, we're going to note down the 3 scores that the athlete achieves. And we'll often be doing this in groups, of course, as well. And then beyond that, we need potentially we need some kind of VJ, that means vertical jump kit. There are things, you might have used these, vertical jump belts, and you may have used the stands. Okay, so there's numerous different ways to actually do this. And as I said before, if you want to use this in your answer, this example is what we call a vertex machine. Okay, a vertex machine. So you can use it if you want. Now, strength of this test is that it's valid. It measures what it claims to measure. Valid measure of, what do you think is going to come next? Of leg power. Okay, now that's also going to lead to a criticism, of course. It's a valid measure of leg power. The other strength of this test is it's super simple. Okay, so it's cheap, it's practical. Now on the negative side, we have 2 things. We have measurement issues. You know, it's hard to be confident that the athlete is marking at the top of their jump. The other point we'd make there is it's leg power only. And are we arguing that that is applicable to whole body power for an individual? Is it applicable to whole body power? And some would argue that it isn't. Okay, let's move on. Keep going. Next bit of paper. Let's move on. It's very noisy around me today. If you're getting a little bit of interference, I apologise. Someone's gone strimming crazy somewhere near me. One of the noisiest things, petrol strimmer. They're noisy objects, aren't they? Okay, sit and reach test. Couple of things. First of all, guess what? We are warming up. Let me put it in here. We are warming up. Warm up. Okay, so there needs to be a warm-up. By the way, guidance on that is 10 minutes before. Now, beyond that, we want to do certain things. We want to remove shoes. Okay, so the athlete is going to remove their shoes. We want feet flat against box. Feet flat against box. We also want there to be knees locked, or you can say straight legs would be the same point. Knees locked. So let's just apply those things. The athlete here has to remove these shoes. Okay, their feet have to be flat against this surface, so we have to get rid of this gap. And these knees need to be straight, so we need full extension on the knees. Now, a couple of other things that you might find useful to know. Palms down. When the measurement happens, the palms must be facing down. And another point we've got is hands on top of one another. On top of one another. Okay, hands on top of one another. So if you think about how that would work, you'd literally reach out with one hand, sort of fingers on top of the fingers of the others. You don't have to interlock them or anything like that, but it needs to be done that way. Other point is that athletes are allowed what we call practice stretches. Okay, they're allowed practice stretches before the measurement's taken place. And then what we've got is that we've got a hold for 2 seconds. Now, can you guys all check your specifications? Some specifications say 3 seconds for that, but I'm going to put 2 seconds here. I'll use 3 seconds when we do an answer later, but hold for 2 seconds. That's one of the things you need to do. And of course, then what we're going to do is we're going to record the answer. We're going to record the output. And by the way, on the recording, we do to the nearest centimetre, so they must be integers. Okay, they must be whole numbers. Now, practicality, let's go over this. We must have, in terms of equipment, we must have the official sit and reach test, sit and reach box. Okay, if you make one yourself out of wood, it might not be accurate. And again, look at this term. We've got perpendicular surfaces. Perpendicular surfaces. Now again, you can also make the argument about clipboard. Okay, so I'll put that in there. Okay, that is necessary because we need to record the scores. Now, in terms of positives and negatives, we're saying that it's a valid test. Valid, but it's valid for something specific. Valid for lower back, and we'd include gluteals in that, and hamstrings. So it's a valid test for lower back and hamstrings. I guess it's also a valid test for the shoulders as well. They're also flexing here. And the other point is it seems to be really reliable. Results are consistent across multiple attempts, and of course we can compare them to standardized data. On the negative side, we can say it's lower back and hamstrings only. Okay, we can criticize on that for that reason. Okay, possibly shoulders, as I said before. And the other thing is, get ready for this, it's not good for kickers. Okay, what do you mean, James? People who in their sport do a lot of kicking of a ball, for example, tend to get very, very tight hamstrings. So this measure of flexibility will overemphasize that limitation. Okay, that's all about the stretch reflex that activates when a dynamic kicking action is done. I'm not going to get into that now, but it's quite common. So this would produce particularly poor results for someone like a footballer or someone like a playmaker, a number 10 in rugby, something like that. Okay, so final one. Bit of paper. Ooh, this is going longer than I thought it was going to go. Illinois agility test. So, a couple of things here. What am I going to say first? You're not going to be surprised. We must warm up. 10 minutes before, there must be a warm-up. Other points. When we start this, we start the test face down. Start face down. Okay, so here's my start line over here. The athlete is going to be flat on their tummy with their hands by their sides, facing the start line before they start the test. So they're going to start face down. Of course, getting up to one's feet is an aspect of agility. The other thing I was going to say there, I think I just mentioned it, is hands by side. It has to be done that way. Okay, that's really important. Then what's going to happen is the assistant is going to shout go, and of course they're going to start timing. And you may notice here that basically what we've got is a 10-meter course. Okay, so what have we got here? We've got 10 meters from here to here. This is 10 meters. They turn, they weave, they weave, they turn, 10 meters, they turn, 10 meters. The watch stops there. Okay, so 10 meters there. Each chunk, if you like, each up and down is 10 meters long. And effectively what we do is we run times 6. If you look at what I've just shown there, you run that 10 meters 6 times. So it's effectively a 60-meter test with loads of weaving and turning involved. So other points, follow course exactly. So if the athlete touches a cone, if the athlete misses a cone, the test is over. Make sure we understand that. Okay, now, let me put that in. Do not touch cones. Do not touch cones. Very precious, this particular test. Do not touch cones or the test is over. All right, and that the reason we do that, of course, is we're looking to show that agility is change direction with control and precision. Now, equipment. Of course, we've got quite a bit in this one. We've got a tape measure. We've got cones. None of these things are expensive, of course. We've got stopwatch. It's still a practical test. As long as you've got space, you can set it up. We need a flat, and we even say here, a clean surface. A flat, clean surface. And as always, we need our little helper clipboard, our assistant's clipboard. On now, the positive side of things, we've got a test which is simple. It's practical. We can put it in place easily. We've got a small space for, if you think about it, relatively speaking, within 60-meter running in a relatively contained space. So that's nice. We also find that the test is reliable. Tests results are consistent. And this is really good for games players. Okay, so it's a really nice test for games players, especially running-based games players, of course. On the negative side, this test is running-based. So this is not, and it's straight. When I say straight line running based, I mean, you obviously understand that we're weaving. But think, I mentioned the table tennis player before. Remember, the table tennis player moves a lot side to side. That is not overly emphasized in this particular test. So this running based does cause an issue of validity for some athletes. We've still got the majority of athletes who are games players, running based, that kind of thing. But this is just a validity issue for those who aren't. All right, I've gone way too long on these things, so I need to be quick here. So, a couple of things I'd like to go over with these answers. Let's just go through them quickly. So the first question here is asking me, Josh has been trying to improve his flexibility. Good. Describe 3 features of the sit and reach test protocol that make it a valid test for flexibility. So I've got to describe and I've got to describe validity. So describe, we'd often expect things like is characterized by, is like, is composed of, this kind of language. So let's see what we've got. The test is characterized by, there's my descriptive language, taking shoes off, maintaining straight knees, and holding the stretched foot. Note the number, 3 seconds. Check your exam board whether they accept 2 or 3, please. So stretching for 3 seconds. And I get my mark, I get my max. And let's just go a bit further. If these protocols are followed, is it a valid test for gluteal, so lower back, bum, and hamstring flexibility? That's a nice point for me to add in at the end, because what we're saying there is, look, this is a valid test, but specifically of that area. Next one, evaluate. Evaluate means strengths and weaknesses, okay? Now, the other thing with evaluate is that, generally speaking, we will reach a conclusion. Whether we'll do it for a 4-mark question is another matter, but it would normally involve a conclusion as well. Let's have a look. Evaluate the 30-meter sprint test as a measure of speed for a sprinter. So a strength, so I'm evaluating, is that it measures top speed. Great, circle, tick, 1 mark. A weakness is that it does not measure accelerative speed. Okay, so it doesn't measure that. And of course, that is relevant for a sprinter. Next points. On the one hand, so looking at it from one perspective, I'm evaluating, it is running based. It is a running based, it should say test in there, shouldn't it really? It is a running based test. So a valid measure for sprinters, However, it does not measure the sprint start. Okay, so I've looked at both sides of the argument. You can make a point now that I should reach a conclusion. Overall, it's a very good test for 100-meter sprinters. So we could go a little bit further now. Explain why. Okay, when we explain why, we're going to do lots of becausing. Okay, because we might have a therefore, comma. We might have a this means. This kind of language is explaining why. Explain why the Illinois agility test is not considered an important measure of fitness for a sprinter. So why not? 2 marks to get. What do we have? This is because the Illinois test measures changes of direction. Okay, so we've got changes of direction. And in sprinting, there are none. Okay, that's probably going to get me my marks. Therefore, comma, sprinters need a test such as 30-meter sprint or a power test such as vertical jump. You know, would I potentially get an extra mark there if it was available? Because I've recommended an alternative methodology. Possibly, who knows? But what I've done there is I've said why it's not a valid measure. It measures change of direction, and basically in sprinting there are none. Now, obviously, you can make an argument the sprint start is a change of direction. I accept that, but we can make that point differently in other questions. Okay, let's move on. Okay, in this second session, we're going to have a look at numerous aspects related to a broader picture of fitness testing. A lot of what I want to do here is linking to components, okay, linking to components. We're also going to have a look at an analysis of results. Remember, analysis means to break something down and explain it, or it could be to say what happens next. So we're going to do an analysis for results. And I also want to look at reasons for and limitations of testing. Okay, reasons for and limitations of testing. So all of those things are going to come. Now, what we've got here is we've got a set of results for Josh. Now, obviously, in all of the cases here, assuming that the sort of the spider graph is nearer the outside, if it's nearer the outside, we can assume it's a better score. The one exception is body composition. For body composition, the nearer the score is to the middle, in other words, the lower the score, the better we consider it to be. Now, I have to say, the way we depicted that, I'm personally not overly chuffed with, but there you go, that's where we are for today. So what would we say about this athlete? You know, we'd expect there to be peaks of power. We'd expect reactions to be very good. We'd expect speed to be high. And when we look at fitness test results, we might make an assumption that if something is high, we leave it. But of course, that is relative. We leave it. I couldn't write it. We leave it. But of course, what we find is that if the score is high, but the component of fitness is crucial, so if it's high and crucial, we train it. Okay, so let's be clear here. For this particular athlete, we're not going to leave power, reactions, speed to be, we're already good at that, Josh. No. What we're going to do here is we're going to continually train those areas. Now, if they're at optimum level, that becomes a process of maintaining fitness. But, of course, in this case, there is room for improvement. So we are looking to develop in those particular areas. Another good example would be something like strength. Strength is closely related to ideas of speed and power, of course. So we would be doing something like strength training in quite a lot of detail. Now, the other thing I would say here is we have to analyze these results, and we have to ask the question, well, Josh, what is crucial? What is crucial for Josh? Okay, because we could look at something like cardiovascular endurance and say, well, it's really poor, so that's crucial for him to participate. But Josh is an elite sprinter. Okay, so let's remind ourselves he is an elite sprinter. So what do we consider to be crucial for this athlete? Well, certainly power, certainly speed, certainly strength of the right kinds, certainly reaction time. Okay, these are really crucial areas, and I would add one in there, which would be flexibility. Without getting too complex here, the ability to have good knee flexibility is really important, because especially in the flexion phase, because it's that recovery which is going to decrease. Let's not get into it. Decrease moment of inertia and increase angular velocity of the hip. Why did I go down that road? Ignore that bit. Okay, but the point is there's a reason. We need good flexibility for a particular reason in sprinting. Okay, so we've got these things that are crucial for Josh. Now, of course, we can say, well, they're pretty good. They're pretty good. Okay, they're pretty good. But we're still going to work on these. We could also say what is not crucial for Josh. And of course, we've got numerous things there. We have things like CV endurance. Use the term CV fitness, if that's how it appears on your specification. We've got CV endurance is not particularly important for Josh. Something like balance, I don't want to say it's unimportant, but it's less important. Yes, the dynamic balance in this performance is very important. I know someone can make that argument to me, but I'm creating a general picture. So, of course, from these results, we are going to continue to work on these areas. Now, a couple of other things I want to address with you quickly. The reasons for fitness testing. And particularly, of course, we're going to do strength and weakness analysis. That's what we're going to use our testing for. So reasons for fitness, strength and weakness analysis, and that can happen anytime. Another point is we want to monitor improvement. Okay, monitor improvement. Okay, so fitness tests allow us to monitor the development of what we've been doing in training is effective. We can also create, and this is a really nice term to use in your answers, we can also create what we call baseline testing. This is the testing we do before a training program to find out what the base fitness is. And we can often say that this should be pre-schedule, so before the fitness training starts, but we also often say that we do this stuff in pre-season. So those of you that look at seasonal training, for example, you can mix that idea in there. We also have the notion of fitness tests for what we call interim training requirements. Okay, so fitness tests can give us short-term information about what we need to be doing now to make things work or to make things better. Other reasons for fitness tests, we can compare, as long as they're standardized tests, we can compare to averages. That's how we've managed to get that data about Josh, for example, compare to averages. Now, a couple of things. We can compare to national averages. We can compare to normative scores, an important term for you. Those are those crazy tables I'm sure you've used. Normative scores. We can compare to performance levels, okay? So we can do lots of comparison work. The other thing about fitness testing is it leads to a variety of training. Okay, so if you look at what we just did with Josh there, we said, right, we need to work on power. That's going to probably bring in some plyometrics. Speed, that's probably going to bring in some interval training. Flexibility, that's going to bring in some stretching and some mobility training. Strength, we're going to do some weight training. Reaction time, we may be doing some reaction training. It encourages variety in training because we look at the whole picture. For the athlete, it really helps to, what have I done there? It really helps to motivate the athlete. And the other point, and you can think about this in relation to your SMART principle if you want, we can set measurable, that is an M, believe it or not, I'm trying to go through fast here. We set measurable targets, okay? So we set measurable targets. Now, we have some limitations of fitness testing, limitations. Certain things that fitness testing kind of messes things up for us. So first of all is human error. Okay, so it's what we call the wrong protocol. You know, if we measure 31 meters on the 30-meter sprint, we mess it up, we get the wrong score. We often find with what we call field tests is they are not sport specific. So if we're doing something like a multi-stage fitness test, if we're doing something like a Harvard step test, if we're doing something like a vertical jump test, these are often not sport specific, so can only be applied to a certain degree. The other point, this is a really nice part to put into your answer, they don't always replicate movement. Okay, so it can be sort of an odd thing that we're doing that has nothing directly to do with our performance. They don't replicate movement. We can also say or competition, because of course when we are doing fitness tests, we're kind of in a relaxed environment where all we need to focus on is jumping or whatever. When we're in our competitive environment, we've often got to focus on our opponents. We've got to do other things. We've got the psychological pressure of competition. It's a different environment. So we often say with fitness tests is that they may not measure things. Depends on the test, okay? It may not measure things. So we can describe many fitness tests as not a measure, but a predictor. Multi-stage fitness test is an excellent example. It's a predictor of what we call VO2 max. It does not measure VO2 max. This means that we can argue that sometimes, maybe even often, that tests are inaccurate, okay? Therefore, if that's the case, we have to make the argument that very often that they're not entirely valid. They're going to give an indication, but they're not entirely valid. Now, another point we've got to make, motivation aspect again. Many tests are what we call maximal. A maximal test is hard. It's hard to push someone to their maximum. It's hard to push yourself to your maximum. So we may well be measuring or predicting the point at which an athlete gives up, not at which the point the athlete's body gives up, if you see what I mean. And we can have with some tests issues of reliability. You know that if you do the test again, you get different results. I mean, there's all kinds of examples of that, but some of them involving more technical equipment can be quite good ones. But reliability is often a concern. The other one I find is real issue of reliability is those real base tests, things like ruler drops, Anderson wall toss tests. These tend to often return, quite odd results. Okay, so you have to do them over a period of time to get a picture. So those are reasons for limitations. Now, let's have a look at some questions, folks. Let's have a look at some questions. So we want to ask here, Josh is a sprinter. We agree. Identify. Now, this command term simply means name it. Identify 3 crucial components of fitness to his performance. We've kind of already done that. And explain how he would improve his fitness in one of these components. Okay, so we've got Josh is a sprinter, and we've got to basically we've got to identify 3 crucial components, and we're going to explain how he improve his fitness in one of these. Now, this is a 6-mark question, and I've answered it already, but I want you to show me the error in my answer, because I want to get you guys to rewrite this. What is it that I've done wrong in my response? I want you to pick it out, and then I want you to submit a really high quality replacement. So let's have a look at it. So here's part 1. The 3 components of fitness are, I'm simply naming them, speed, power, and reaction time. 1, 2, 3, probably. Okay, 1, 2, 3. I've named 3 crucial components. I could have named, I could have looked at flexibility. We could have looked at strength, for example. So we seem happy with that. Where's this error coming from? Let's have a look. Next bit. Improve speed through high quality interval training. So let's take this first one. Interval training. Thank you. Get me a mark. Here we go. Next one. Improve power through high-quality plyometrics training. No mark. Improve reaction time through high-quality reaction training. No mark. Why no mark, James? Because I've been asked for simply how we'd improve one of these components. So what does that mean? It means that this here is what we call IRR, irrelevant, because I've chosen interval training. Now what I've got to do is describe the reps, the sets, the percentage intensity of that interval training, because that's where my +2 more marks come from. And what I failed to do is just focus on one that I've been asked to do. So it says crucial component, the 3 crucial components of fitness, improve one of them. And I've given a vague general point about improving all 3. And of course I might get my 1 mark for interval training related to speed, but I'm not going to get the other 2 because I've taken interval training nowhere further. There's 3 marks available there for describing interval training for Josh. Okay, so we might be saying something like 3 sets of 10 repetitions of 80 meter at maximal speed, maximal intensity. That's where my next bunch of marks is going to come from. And again, these are things that we can often slip up on very easily within exam situations. Next question. Evaluate. We know this is strengths and weaknesses. Evaluate the validity, reliability, and practicality of 2 fitness tests. This is a super hard question. How do we do that? Okay, so how do we look at the validity, reliability, practicality altogether of 2 fitness tests and evaluate them? It took me a long time to think about this question. I'm still not completely happy with what I did, but this is how I did it. So I'm going to take the vertical jump as my example. The vertical jump test, so here's one of my 2, is valid because it measures leg power. Okay, I might get a mark for that. Because results are consistent. Okay, so I might get a mark for that, saying why it's valid and reliable. Okay, but now I might be at what we call a submax. Okay, I've got my 2. I can't get anything further for the vertical jump test unless I give a weakness. And it's practical because it's simple and cheap. Okay, that could have got me a mark. On the other hand, it is a measure of leg power only. Look, there's my other side of the argument. And now I get another submax because I've got 3 marks for my first test. So I looked at validity, I looked at reliability, I also looked at practicality. Looks simple and cheap, but I have to look at the other side of the example of the negative to get my mark. Let's have a look at another example. The Illinois agility test, the one I chose, is valid because it measures the capacity to change direction with control. Okay, so there's my mark, because I'm saying that's why it's valid. It genuinely measures agility. It's reliable because scores are standardized. Okay, so standardized scores. There's my submax again. So I could get practical because it's only basic equipment is needed. A negative, look at my evaluation, is it is more suited to runners than other athletes. And now I get my max. Now that is a very interesting question because when you read it, it looks like you've got a huge amount to do. But actually what I did was quite simple and I needed to understand that question structure. Now, for you guys, I'd encourage you to study and repeat what I just said. Okay, so you're going to need to go back to my description there and you're going to need to go over that point. I'm pretty confident that none of the theory in there is challenging for you. The issue there is structuring the response to this specific really tough question because we've got to look at validity, reliability, does it measure what it claims, reliability, is it repeatable, practicality, is it easy to set up, and we've got to do that for 2 fitness tests, but we must give an evaluation, we must give a negative as well as a positive. Really interesting question. We managed to get 6 marks. Can I remind you, you guys need to do a better version of that than the one I've demonstrated because I only got 4 here. Okay, I want to see an answer from you that gets a 6. Okay, so here we are, and to be honest with you, we've got quite a lot of information already on your notes pages. And already for you to potentially write about these concepts. What I want to do is put a bit of meat and understanding around each of these training methods. Again, let me be clear. We are separating them into aerobic and later anaerobic methods, not because that's exactly how it's specified on your course structure. It's just a way of delineating why we're looking at some in the first session and some in the second session. When I say aerobic methods, what I'm talking about here are methods which are focused on developing cardiovascular endurance, or if it's the word you use, cardiovascular fitness. For those of you that study a notion of VO2 max, you obviously want to be drawing that into this consideration as well. Only some of you look at that concept. Now, there's really, I guess, some key facets to studying any training method. First of all, we want to be able to describe it. That would seem really, really useful to be able to describe this. What are the facets of the training method? But the other thing I want to be able to do is to apply the fit principle. Now, I know you on the Eduqas or WJEC WJEC board, you're going to say to me, well, we don't use the time, we use duration. Figure it out, okay? Duration and time, they're the same things, right? So we're going to apply the fit principle. So to each of those, we're going to apply this notion. Now, I want to start with this idea of continuous training. And really, it does what it says on the tin. How do you say that phrase? It does what it says on the can. You know what I mean? It is fairly obvious that continuous training involves continuous and what I'm going to describe to you as rhythmical exercise. Continuous and rhythmical exercise. So a couple of things for me to begin with. I want to know that I can use the word rhythmic exercise. Rhythmic exercise. You might be thinking to me, well, what do you mean by rhythmic exercise? Is that to music? Is that a kind of dance? No, we're saying that it's one step after the next, 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 or if we're swimming, one arm action after the next, after the next, after the next. It's some kind of consistent or steady state rhythm. And therefore we can consider this a form of rhythmic exercise. Another point for me, which is really important, I mean, it's kind of obvious, but there's no breaks. Okay, when we say no breaks, we mean there are no rest periods within it. So this, by definition, is the opposite of what we'd refer to as an intermittent exercise. Think about something like interval or weight training. These are intermittent exercises, but this isn't, because it involves no breaks whatsoever. We already know that this model is aerobic. Now, when we're talking about aerobic, really, we want to apply this to the fit principle. So if we take intensity for a second, we mean by that we are applying an intensity of something like 60 to 80% of HR max, of heart rate max. Now, remind yourselves how to calculate heart rate max in the simplest form, and that is you take the maximum figure of 220 beats per minute and you subtract your age. So for you guys taking this tutorial, assuming you're 16 just for a moment, your maximum heart rate is going to be in the region of 204 beats per minute. So therefore, we are interested in finding out 60% of that, okay? 60% for the lower end. And let me be clear, when we talk about the aerobic zone, this 60% of your maximum is what we call the lower end, and this is what we call the upper end. In reality, if we're working with really, really high quality aerobic athletes, they are going to be going into your 85% of heart rate max during their training. That is going to happen. But the zone we're going to focus on for now is 60 to 80%. Now, the other point I'd make about that is that for this athlete here, I would say, I mean, just purely from an aesthetic perspective, she looks like quite a regular runner to me. It looks like she's done that before, right? So I would be expecting her to be nearer that 80% level if she's doing this 2 to 3 times a week. All right, so it's not just that we're somewhere in between 60 and 80%. No, we're specifically finding a point, or because heart rate is very changeable, we are going to be obviously looking at a range within that, because you can't stay at one heart rate by design. But we are going to find that with someone who's well trained, we're going to be nearer that 80%. Remember that anything less than 60%. Anything less than 60% is what we call fat burning. It's all of a sudden not kind of aerobic conditioning. Things like walking, things like doing kind of gardening, things like that, washing the car, they're going to be in that fat burning zone. So we're not so much interested in that, because we're looking at aerobic conditioning. Okay, a couple of points. This one's already up here. We've got the, by the way, we can call that low, or what I like to call moderate intensity exercise. Okay, so if I just come back up slightly. We're talking about low to moderate intensity exercise. Can you get that language into your answers? Moderate intensity. We can be specific with what that is, moderate intensity. And we're saying here it's a minimum of 20 minutes. Now, the other thing I put in here for you is kind of the time phasing. So we're talking here about 20 minutes up to 120 minutes. Now, I know, again, some of you are going to say to me, well, you can train for longer than 2 hours doing continuous training. That is true, but that would be a very, very extensive training period, okay? Competition period, yes, if you're doing marathon, triathlon, endurance-based stuff, Ironman 70.3, whatever, all that stuff, yes, you're going to go longer than that, and that's where kind of refueling comes in and so on. But this 20 minutes is actually an interesting figure. Without getting into it in too much detail, 20 minutes represents the average time it takes a human being to be able to get activated and start moving fat to the muscle, which is then burned aerobically. So this is not an accidental number 20. It's not like, oh, roughly 20 minutes. No, 20 minutes is actually how long it takes on average to get fat into the muscle for oxidation, for producing energy. Okay, so therefore this is at least partially why we define this 20 minutes. Other points I want to get to. We can often consider, this is in the more kind of elevated knowledge here, we often consider continuous training to be graduated. You might be thinking, well, what do you mean, James, graduate? Does that mean you start jogging, then you do some sprinting? No. What we find with graduate continuous training is for someone that's particularly unfit, they can start do it by sort of brisk walking. Their first 5 sessions could be brisk walking. Then they could get into very light jogging. So that's where jog helps us out there. And then once fitness is up a little bit, we're into the notion of running. Okay, now you can compare that to cycling and swimming based activities. I'm just going to talk about running just for the sake of it here. Now, finally, I want to talk about this word here, steady state. Okay, steady state exercise. Now, steady state's an interesting word. Scientifically speaking, it means that oxygen supply is meeting oxygen demand. So what we'd find, of course, in the oxygen consumption curve is we'd have a plateau, we'd have a steady state. So that steady state aerobic exercise means that we are providing enough oxygen to power the movement once we are into the activity. And it's a nice term for you to use. Now, we always want to be prepared to evaluate. So with this evaluation, of course, we're looking at strengths and weaknesses and a conclusion. So let's look at our strengths. Continuous training is simple. It's cheap. So if we were nicking a term from fitness testing, we could say it's got very good practicality, right? We can also measure the intensity. So we've got good intensity accuracy. Think of that in a technological way as well, in terms of proliferation of heart rate monitors, of Fitbits, of devices on phones. We can be very accurate with our training zones. Next, this is all age groups. Aspects of continuous training can be done by the young, the adult, and the elderly. Now, I know some of you can say to me, continuous training for young children, James. Okay, there's limitations to that. But broadly speaking, anyone who's in a training age can do this. And it's essential. And what we mean by this is that even if your performance is not purely aerobic, you're very likely to use this training in that's not going to work, in something like that's working either something like a pre-season. Okay, so that general conditioning work in pre-season is also really, really essential to athletes. Now, on the negative side, people find it monotonous or tedious. In other words, people will go, oh, it's boring, I don't like going out running, for example. It's time consuming, a 30-minute run takes 40 minutes. What James means by that, well, why am I talking about myself in the third person? What I mean by, why do people do that? What I mean by that is warm up 10 minutes, 30-minute run. You've probably got a bit of a cool down at the end as well. That's a 45 minute adventure for the gains you're looking for. And if we look at some like HIIT training, high intensity interval training, only some of you study it, but it's much faster. Right, it's weight bearing. What does that mean? That means that this person may end up having problems in joints over a long period of time. Okay, so we've got some weight bearing issues here. Overuse injuries, things like stress fractures, things like shin splints, these sorts of processes can happen because if people do too much running, for example. And this is a really interesting one. Continuous training is thought to decrease maximum speed. So if a performer has a combination in their performances of speed and endurance work, this might not be at least the type of training to do in isolation, not the one to do in isolation. Now, let's then look at an alternative. And I repeat, I'm not going to look, let me also say I didn't really apply everything there. So we've done our intensity, we've done our time. We're going to do type by looking at a different one in a moment. In terms of frequency, we're looking at a great figure to use here is 3 times a week, and we would consider that to be a minimum period. Okay, you should have said that. The same applies here, 3 times a week for fartlek training, and we could obviously vary these and mix these up. What is fartlek training? Well, we always love to make that point is, well, it's Swedish for speed play, fine. But what does that mean? It means that this activity is really well suited to people like games players, especially people like midfielders, say, and people who take part in sort of varied terrain. So something like a cross-country runner over the winter is going to be well suited to something like fartlek training. So how does it work? So it's an endurance training. We can certainly say that. It's good for games players and cross-country runners. I've just wasted everyone's time by writing it out again. And look at here, it's speed play, but speed play means that we've got changes in terrain, in speed, and in incline. So let me be clear on this. Let's say we go for our 20-minute minimum period. Let's say we go for our 20 minutes. We are going to vary the speed of the run. So all of a sudden we can't call this steady state. We are going to be building up kind of little oxygen debts, and next we're going to do some anaerobic work. We could vary the incline. So doing some hill sprints or hill running would be a good example. And we could vary the terrain, and by varying the terrain, for example, we could run on grass instead of the concrete of the paths. We could run on fields. We could run in sort of boggy conditions. We could run on sand. This changes the condition in which the athlete experiences, in our case, the running phenomenon. Okay, so these things allow us within that period to work on different aspects of aerobic performance. But notice as well, because of this, we are potentially doing some anaerobic work. I mean, we're always doing anaerobic work, let's be honest, but we're potentially doing more anaerobic work. So this training method is aerobic and endurance based, but it begins to flirt with the notion of anaerobic thresholds. Now, let's also have a look at some strengths and weaknesses evaluation. So first of all, we've got more varied than continuous, so it kind of defeats this monotonous point, hopefully. It's non-rhythmical. In other words, it doesn't become tedious because we're just doing the same things over and over again. We've got different sessions, so you train, let's take our 3 times a week figure, we train 3 times a week, and the session's different each time. We're doing fartlek tonight. What we're doing, we're running on the beach. Now, okay, you need a beach available, but it varies the experience, right? You get the idea. It's more sport specific. So again, come back to our games players, the changing intensity. And again, it can incorporate speed, whereas continuous training can limit speed. But we have negatives. So we need the locations. We need the countryside paths. We need the fields. We need the beaches. We need the sand to be able to do this. And the other thing is, this is a very individual training. Now, I'm going to say to you, do you think that's a weakness of the training method? Well, the point would be, if we're planning group training, this would become harder. So imagine you're doing fartlek training for goalkeepers. They probably wouldn't do it. Defenders, midfielders, and attackers. Okay. If you had one single session for all of that, you're probably missing the requirements for all of them in one form or another. If you try and generalize it, the sprinters are going to need, the forwards and the attackers are going to need more short, sharp sprint work with kind of active walking rest. The midfielders are going to need more steady state, moderate intensity work in that continuous training fashion, and so on and so on. So how do you get a group identity to all of that? Now, we also want to answer some questions. In fact, I'm probably going to make this a little bit bigger. I think that's probably a bit small. Oh, this makes me nervous doing this on the when things are live. Okay, let me make that a bit bigger. Let me drag it across. There we go. That's nice. So we've got a question here. Evaluate. Well, we already know what that means because we just looked at it. It means give strengths and weaknesses. The other point I'd make about evaluation is ideally you should really reach a conclusion. Okay. Now, in this case, we were only doing 5 marks. This is probably not a level question, but if you want to make it a level question, by all means, bump your marks up and write it as if it was. Okay. So we're just giving an example of a structure. It's not to say it's going to be exactly like this. Evaluate continuous training as a method of developing aerobic endurance or aerobic fitness. Just check which term you use, aerobic endurance or aerobic fitness. I mean, you obviously know it's talking about the same thing, but which term would you use, cardiovascular endurance or cardiovascular fitness? So let's go about having a go at this. I want to give strengths and weaknesses, and I want really to reach a conclusion. Let me just make sure I've got my stuff ready. First point, look at this. A strength. Okay, straight away I'm into the evaluative mentality. What do you notice about my introduction? How long is it? Where is the introduction? There is none. Okay, so I'm straight in. A strength is that, well, that's my introduction. My introduction ends there, doesn't it? A strength is it works the athlete in the aerobic zone of 60 to 80%. Now, of course, 60 to 80%, let me just change that green slice. It should be red. What am I doing? 60 to 80% heart rate max, must have the units, is likely to get us a mark. A weakness, look, I'm evaluating, I must look at the side, is that it can reduce speed. Thank you. I'm clearly evaluating the methodology. It's clear I am evaluating. Please, I urge you guys out there, if you're asked to evaluate, you must do exactly that. I know some of the teachers are advising that if you get an evaluation question first, you must describe it, then you must explain it, and then you must evaluate. This sort of thing, okay? If you've been advised by your teachers, feel free to follow that methodology. My point to you, and my point to any teacher that's advised that, is how can you evaluate something without describing it? Would you all agree that that 60 to 8% heart rate max is a descriptive point regarding this methodology of training? It would be odd in any kind of typical human behavior to do all the descriptive points, continuous training is 60 to 80%, it's steady, and then to start evaluating it. Okay, so my point would be, if you do a good evaluation, you've got descriptive points by nature in there. Okay, so there's my little offering. So, which is important in sprint finishes. So I'm saying why reducing speed would be bad in this case for Kate. Let's move on. On the one hand, comma, don't forget that little comma, on the one hand, comma, it is long duration. Okay, so we've got long duration. Could I have been more specific there? Could I have said something along the lines of a minimum of 20 minutes? Could I have said it would be 45-minute training session? Okay, long duration, so suits aerobic athletes. On the other hand, comma, athletes find it tedious. I could have used the word monotonous in there. Athletes find it tedious or monotonous. And how do I finish this process off? Oh, look. In conclusion, comma, because you're always going to put that in there, continuous should be varied with fartlek or HIIT. So I'm recommending that the best thing to do is to mix this up with fartlek training or with HIIT training. Remember, only some of you study HIIT. Check if you do study it, but it's an aerobic methodology. So there's my evaluation. Next, I've got an explain why question. Explain why fartlek. So here's my command. Explain why. As soon as we see explain why, we are becausing, we are therefore commaing, we are this meansing, this means, we could be using through, tends to be more explain how actually, we could be using by, that sort of language shows that we're thinking through the explaining why methodology. Explain why fartlek training is a relevant training method for a games play. And of course, we've got Julie here, who's our example. So let's have a little look at the answer. Look what I've got straight away. This is because, again, where's my introduction? Where's my waffling opening statement? Oh, there isn't one. And should you make any? No. Get on with your answer. This is because fartlek involves changes in intensity. Changes in intensity, much like games. Okay, so it's game related through varied speed. So now I get my second point there. I could say incline or terrain, of course, but incline and terrain is not as closely related to netball, for example. Excuse me, I might sneeze in a moment. I'll try and keep going. Hopefully I can ward it off. Next, Therefore, comma, so that I'm clearly in the explaining modality. Therefore, comma, fartlek maintains speed, which of course was our weakness for our continuous training, and works both aerobic and anaerobic systems. So I've got my max. So for me, the content we've already, you guys, it's not going to be difficult for you guys to learn that content. You just got to learn it and remember it, basically. But for me, the skill here is really important because I'm clearly evaluating here and I'm clearly explaining why here. And this is not a difficult thing to do. It's difficult if you've learned key points and never evaluated them before. It's difficult if you've confused between what describe and explain means. But other than that, as long as you understand the concepts, getting your knowledge down should be nice and straightforward. Okay, and we are back. And actually, I should have a title in here. Obviously, we're talking about methods of training that would be broadly considered to be anaerobic up here. So, sorry, we should have a title in here. I apologise. So, first of all, let's get to the notion of resistance training. Just bear in mind, of course, that you may simply refer to weight training. And again, the image we've got in here does an awful lot of the job for us. Let's actually go through these points briefly and make sure that we understand some fundamental principles and key descriptors and explanatory points with regard to this methodology. So, first things first, we are saying that resistance or weight training is good for the following, okay? Now, we already know, guys, to be clear, we already know it's very good for strength, right? So we are assuming you guys already know that its key framing is towards strength development. But you notice here, it's good for speed, it's good for bulk. I mean, certain types of weight training, very high resistance, low repetition. Weight training is very good for bulking, for example. It's good for muscular endurance in the opposite scenario. So if we do high reps, lower resistance. And it's very good for rehabilitation. Now, let me emphasize this point about rehabilitation. You might be thinking, right, well, if you're injured, why would you start lifting weights on the injured part? Well, that's exactly what you don't do. Weight training is really important because it allows you to perform something called muscle isolation. What do we mean by that? Well, it means if you've injured your right shoulder, you can work on your quads, hamstrings, and calves, and your gastrocnemius. Okay, so you can work on areas of the body that are uninjured. Now, there is also a role to play in weight training once the person is back in the return phase of their recovery. But generally speaking, it's good for rehabilitation because we can isolate groups that are not injured. We can work in that way. Now, if we take for a moment the idea of intensity, okay, let's take intensity of training from our FIT principle, or if we want WJEC, our FID principle. We're saying here that we measure intensity, as we see up here, look, we measure intensity as percentage of one repetition max, okay, of percentage of one repetition max. So each weight training exercise is judged by intensity by the percentage we are lifting, often in numerous reps, the percentage of a one repetition max, the maximum we can lift in that particular lift. And again, you see here, look, muscular endurance is going to be something like 55 to 75% of our one rep max. Strength can be anything, so especially if we're going towards max strength, can be anything between 70 and 100% of our one repetition max. And notice here, when we're talking about time, we've also got specific rest periods. Now, time in, let me just change colour actually. I often hear that people can't see reds very well. It's probably because your projector bulbs are not very good. Time can be broken down really into three factors in resistance training. So first of all, how many reps do we do? That is a measure of time. Get it clear in our minds. If we do 8 reps, that is not a measure of intensity. It's a measure of time. Therefore, our sets are a measure of time. And we've also got our recovery periods. How long do we recover between sets? As a measure of time. That's how we actually do that. So remind yourself that a rep, as we've got over here, is a number of lifts. Okay, so in this case, I think this athlete is squatting. If she presses down and up something like 8 times, that's going to be called 8 repetitions. If she breaks that 8 repetitions into 3 different groups of 8, then of course that's the sets, they're the groups with breaks in between. Okay, so something like 3 sets of 8 or 3 sets of 10, we've got it there. And again, we do that differently for different types of athletes. And finally, we've got the notion of control. And again, we've got this in our evaluation of strengths and weaknesses here. Speed of movement should be controlled within weight training. We are recommending here that each repetition should be 1.5 to 2 seconds per rep, assuming we are not training on elastic strength, okay, or explosive strength. Elastic or explosive versions would be faster, okay, 1.5 to 2 seconds per repetition. And again, with that one, that of course makes a clear distinction between this and something like plyometric training, which we're going to have a look at the moment. Evaluation, good for rehabilitation because we can isolate areas. Endless variation. You know, the nature of this activity is that you can study it forever and not know every lift. There's certain classic fundamental lifts and resistance, but it's endlessly varied. It's very impacting. So weight training, resistance training, think about strength and conditioning training generally. Here's my sneeze again. Strength and conditioning training generally are very effective. I'm glad that actually came out because it's been sort of in there for a little while. It does impact performance. So resistance training, weight training does change performance quality. And as we said here, we can isolate muscle groups. So in the case of this performer, she may literally be working on a technique which isolates one of the 4 muscles of the quadricep. Okay, we can do it that way. On the negative side, we tend to start this with little guidance and training. So poor technique has major side effects. A great example is alignment of the core and alignment of the spine. If we get that wrong over a period of time, we can do fairly significant damage. And the other thing is, if we use a weight machine, this athlete's using a free bar, so not the free weights, so not a problem here. But if we use something like resistance machines, they control the movement for us. So we never develop the actual technique which is necessary within this formatting. Again, in terms of frequency, remind yourselves that 3 times a week is a great phrase to put in. And of course, we've got lots of variations within this. Let's move on. Plyometric training. Now, it's almost like we want to lump this in together with weight or resistance training, but we must resist that temptation. That would not be the case. So a couple of things that I would like you guys to draw out immediately. It involves maximal force. Get that clear. Resistance training or weight training does not necessarily involve maximal force because we're probably not going to train at 100% of 1 repetition max. But plyometrics training is maximal force. And this point here is super important. All plyometric movements move from an eccentric contraction followed by a concentric contraction. It really defines the notion of what we mean by plyometrics training, concentric contraction. Okay, so what do we mean by that? Okay, so in this case, what this athlete is halfway through her performance. She has started over here. Okay, she has started over here. She was probably jumped onto there. What she's now going to do is drop off and jump again. Okay, so what I want you to realize here is that as she lands on the ground here, these muscles in her quads, amongst other muscles, are going to perform an eccentric contraction. In other words, they're going to lengthen. They're going to lengthen under tension. Meanwhile, as she now takes off and jumps, as she takes off and jumps up again, that is going to be a concentric contraction. The muscle shortens under tension. And I didn't mean to write concentric, I meant to write shorten. So the muscle shortens under tension. Wasting everyone's time here, aren't I? The muscle shortens under tension. And the reason that's important is that because now these muscles in the quadricep are going to develop an elastic extensible property, much like a strong elastic band, where if you lengthen them and then shorten them rapidly, they're going to build up like this elastic, powerful tendency. So very explosive. So bounding, hurdles, medicine ball throws, depth jumps, which is what I've just showed you here. All of these are classic examples. And again, we're looking here at notions of power. And if it's on your specification, you can use the term elastic strength. Okay, so explosive strength might be another way of putting that. So that's what this is for. So plyometrics does that. Evaluation, it increases power. It's central to many sports. I mean, think about how many athletes perform power movements in games, in all kinds of athletic activities. It's very effective. Okay, so this really works. On the negative side, it can be contraindicating. James, what do you mean by contraindicating? Contraindicating means that it can do more harm than good. Now, this athlete here appears to be a trained athlete, and therefore this is not going to be contraindicating. But if I do this with my 66-year-old mother who's got a problem with her back and her hip, you can see the point, right? Or if I do this with a bunch of 11-year-old kids, you can see the point. The possibility of injury is high, and that's going to outweigh the development, okay? Not suitable for unfit people, I've just mentioned that. Not suitable for young people, I've just mentioned that. So it's quite a specific and precise anaerobic methodology. Circuit training, we all know it, right? We've all been in the inclement or wet weather lesson where we all, or the health and fitness module in PE where we do a load of circuit training. We all know a bit about what it is. So let's go through some details of this. I've got quite a lot on here, but I want to go through some specific points. First of all, let's realize that we are overcoming resistance. Okay, overcoming resistance in the sense that we are going to be overcoming our body weight, lifting weights, doing star jumps, doing press-ups, whatever it happens to be. We are overcoming resistance, and the important point I want to make here is repeatedly. So because of that, this activity lends itself very closely to a notion of muscular endurance, that repeatability without fatigue of being able to perform muscular contraction. Okay, so overcoming resistance repeatedly, and therefore it's very good for muscular endurance. Generally speaking, I'm going to see it here. Let me just change colour. We're going to be looking at something like 8 to 12 stations. That is a guideline. There are exceptions, okay, but 8 to 12 stations is a classic guideline, something along those lines. And what we're going to find here is that with those 8 to 12 stations, you've got two periods. You have work and recovery. So you might work for 45 seconds in the workstation and the work period doing press-ups, say, and then you're going to have 30 to 45 seconds recovery, sometimes active recovery, okay? So that is a classic example. Now, the other point that kind of jumps out from here is we also have to think about circuit design. Okay, circuit design. If this performer here is doing these kind of burpees movements, well, the next movement, the next station is probably not going to be right, that it really heavily works the hip flexors. Okay, if we do another kind of hip flexor workout or something which is really putting pressure on the arms, for example, that design might not be functional because we're going to lead to kind of exhaustion. So there's going to be some issues there. So that circuit design and the order of the circuits, I would say, is particularly important. Other points I think are really nice to draw out of this is circuits can incorporate skill. Okay, so we've talked a lot about fitness training here, training methods for fitness. But one of the nice things about circuit is it can touch on or be directly implicating skill performance. So some kind of skill from the activity, or indeed the skill of lifting, getting the technique right, can be brought into this. Okay? Now, a couple of other things. We like to describe this as a whole body exercise because across 8 to 12 stations, you're probably going to work legs, core, arms, shoulder, everything. Okay, so it's whole body. So we like that point about it. And we can, of course, recognize the point that we've got timed work and timed recovery. I'm getting loads of ambient noise around me. Before there was a choppy dog. Now there's a choppy chopper. It sounds a bit like a helicopter. It may just be a really loud lawnmower. I'm not sure how far away it is. So we've got timed work and timed recovery. And finally, I would say we've got the notion, potentially at least, of active recovery. A classic in circuit training is, I don't know, if you're in some kind of hall and you've got stations here, and so on. So maybe I've just worked on this station and the next one is going to be here for me, but rather than going there, what I'm going to do is during the recovery, I'm going to jog all the way around and then arrive at my station. And it makes the recovery period active for the participant. It's just an example. There's other ways of doing it. So whole body can be skilled, good for muscular endurance. Timed work and recovery, a form of interval training. Bear that in mind. 8 to 12 stations. Circuit can be repeated. Okay. Classic is to do 3 circuits of 45 seconds work with 30-second recovery as an example. And we've got station design and circuit design in there. Okay. So it's versatile. It can cater for large numbers, so it's very practical. We don't need a lot of equipment, so again, it's very practical. And we can target skill and fitness. Goodness. Skill and fitness, particularly muscular endurance. On the negative side, we don't really take records out because we might have 25, 30, 40, 50 people in there, so we don't know exactly who's lifted what and for how much. And you can find loafing. Loafing is like demotivation or hiding. I'm sure you've never done that, right? In a circuit training, you've always pushed yourself to the absolute limits. There's no loafing by you guys, I'm sure. Okay, let me just make this slightly bigger, a bit like last time, okay? Let's just make it a little bit more legible, especially with my dodgy old handwriting, eh? So, interesting command here. I've been asked to compare. When we compare something, we must give the similarities and differences. So we're gonna find words like similarly, comma, however. It's different in the following way. However, comma. We might also find stuff like comma space, whereas, because that happens in the middle of a sentence, comma space, whereas. So one thing is like this, whereas something else is like that. But we must compare. If I just describe weight training here, I get nothing. I must compare. Let's have a look at what it looks like. Weight training develops strength. That's correct. Comma space, whereas plyometrics develops power. Can you see that I have there compared? And I get my mark. Can you start to see immediately how if you're asked to compare something, for goodness sake, compare those two things? Again, the roadmap's going to really help you with that. Next, plyometrics always involves eccentric contractions. However, comma, sorry, weight training does not always. Okay, so eccentric contractions in plyometric, not necessarily in weight training. Another comparative statement. Plyometrics training is explosive contractions. Comma space, whereas weight training is controlled contractions. Okay, I could say 1 to 2 seconds for the weight training. Let's finish it off. Weight training uses bars and plates, as in the weights, the resistance. However, comma, plyometrics uses medicine balls and hurdles. And I get my max. Can you guys see that I have, without doubt, without question, without hesitation, I have compared my different concepts. It cannot be argued any different. Whether the content is right is down to you guys. But for goodness sake, if you're asked to compare, what should you do? Compare. And all you need is this kind of language. We can give you a bit more of it, but you don't need much. Okay? Nice and simple. Similarly, comma, however, comma space, whereas. You're just looking at the other side. Remember that it's with comparison, you can find similarities. So I could have said in here, weight training involves working against resistance. Similarly, comma, plyometrics training involves working against resistance. I'm finding a similarity, not a difference. You can do that. In the questions, you tend to find they emphasize difference more. Not sure why that is, but they do that generally. Now, justify. Justify is a really interesting one. When we talk about justify, we're going to be saying the reason. The reason is another reason. Is one idea, could be, might be, whatever. This is how we do this. And the other thing is when we justify, you might also want to say, I think, or I believe, or in my opinion. Okay, that's what justify is asking us to do. Like with justify, you're giving reasons for something. So let's have for the way it is. Let's have a little look at this. Justify the use of circuit training as a method of improving muscular endurance. So circuit training and muscular endurance, we wanted to justify their connection. Let's have a go. The reason for this, look, there's my reason. The reason for this is stations last for 30 to 60 seconds. Another reason is circuit training requires repeated contractions without fatigue. So it's directly related to muscular endurance. Because of this, stations are specifically ordered to prevent exhaustion. Okay, so we're getting into our justifications here. And finally, I think muscular endurance is best developed by a combination of circuit training and weight training. So we're touching there on that principle of type or variance, some of you refer to that as. We mix our training method up. But am I justifying? Yes, I'm saying the reason for this. Another reason. Because of these reasons. In my opinion, I believe, and I get my marks. So look out for that word. You should realize it means the reasons are, I think, I believe. You should be able to do that. I think, I believe. The reason is, another reason is, one idea could be, one suggestion is, and so on and so on. Let's go back to the studio. Okay, so let's do a little bit of guidance. And my primary aim here is to really get some high quality learning into this topic area, and then to look at what is quite a tricky question, applying this knowledge to sort of genuine exam situations. So let's see if we can achieve that. When we talk about guidance, first of all, we're talking about something, a type of information that causes a technical improvement. So, of course, if you think about any of our athlete profiles, whether it's Kate or whether it's Joe or whatever, cause a technical improvement, we would use guidance because we want to improve their technique. It's a skill-based development. Guidance, I suppose, can be applied to concepts of fitness, but really what we're talking about here is centrally focused on the idea of technical performance within one's application, one's running technique or one's serving technique, in tennis we'll look at a bit later on. So make sure you get that nice and clear. We're guiding people towards the correct way of doing something. Now, we have 4 primary methods that we want to discuss here. Let me just actually zoom this in a little bit further so we can see everything on the one page. I need to make that a bit bigger in a second. So we've got our 4 methodologies of guidance here, and I'm going to start with this visual aspect over here. Okay, and what I want to kind of get to straight away is that the first thing we want to understand by visual guidance is very frequently we are talking about a concept of demonstrations. So you guys will be really familiar with this because you will have been in PE lessons, coaching sessions where demonstration is a key facet of the learning experience. Now I want to highlight to you that it's important that we get real clarity through that demonstration. Exactly what is it that we're looking to demonstrate, and therefore what is it that we're looking for the learner to retain. We're looking for the quality of the demonstration. If the demonstration is of something wobbly or shaky or poor quality, then of course it's going to be much less effective at getting the right technique. And we've got this notion of similarity. Okay, and what do we mean by that is that if a demonstration is being performed by individuals who the observers feel identified with or feel that they're similar to them, a classic would be similar age, same gender, similar or just above skill level. This sort of notion of similarity helps a lot with the retention of information and the motivation of performers. Don't forget that with visual guidance, we can use something like video guidance, which has an O, not an A on the end, James, obviously. So we've got visual guidance, which is performed in a recorded sense. Now, again, if we don't have a high quality demonstration or demonstrator, then of course that video aspect can be really, really useful. And by video, obviously in the modern world, we're not talking about spooled tapes. We're talking about MP4s, which are continuously available on handheld devices. This kind of thing becomes very practical. Now, other points about visual is that we are probably talking about notions of performance analysis. Okay, performance analysis, and let me add the word software in there. Okay, it may well be that if we're working with a netball player, say, who's practicing his or her shooting as a GA or a GS, then it's very likely that we're going to take video of that performer and either overlay it on model technique or compare it next to side-by-side model technique. And performance analysis software allows us to do that, and it's an excellent form of visual guidance. Let me actually write the word comparison in there. It allows a form of comparison. Now, really important point here, I encourage you to get it into all of your answers. all of what I've just talked about help the athlete to create a mental picture, or in the athlete it creates a mental picture. So first of all, you might want to establish what kind of learners might need to do that, and I guess the answer that would come out is that novice learners, sometimes what we call cognitive stage learners, but let's stick with the idea of novice or beginner learners, are very likely to benefit most from this methodology. So that's where we're going with this. Now, I want to address that there are some positives and negatives here. So on the positive side for visual guidance, because we always want to be able to evaluate, this is relatively cheap. Okay, so it's relatively cheap. It's available if there's a coach available. We can do demonstrations with large numbers, so we can get a lot of information to people quickly. And another positive on here, we've got that it's repeatable. Okay, so it's not just a one-off thing, it's a repeatable, potentially at least, action. But we do have some negatives, and what are they? Let me just scoot down here. We do have some negatives. What are those negatives? Well, the first one is demo quality. What if the demonstration is not high enough quality? I remember as in the early days of my PE teaching career, when I never really played basketball in my life, and I was trying to demonstrate basketball skills, it was probably not as good as my other areas that I was teaching. So demo quality does become an issue. Can video, for example, address that possibility? And the other point, and I'd really get you to reflect on this, is that demonstrations need. Let me try this again. We've got the need for verbal guidance alongside. So verbal guidance, which is going to come here, visual guidance needs verbal guidance in combination. So one of the classic terms I would encourage you to get into your answers when you're answering about more than one guidance type is that a combination of guidance types is positive and useful. Let's have a look now at verbal guidance. I'll write this in sort of black because the yellow is not going to show up very well on the white. So here, again, let me write that term, often used in combination. And we already know one of those combinations, so that's useful. Often used in combination. Nice. We could be talking here, a classic example is something like coaching points. Okay, a coaching points, let me think about it. In table tennis, for example, we're looking at a backhand push shot. I would say something like feet must be shoulder width apart and the non-hitting arm must be flexed at 90 degrees and above the height of the table. Okay, those would be classic examples of coaching points to try and elicit the correct technique out of the performer. But of course, it helps if we also demonstrate that too, right? So we often use those things in combination. We also say with verbal guidance, it's what we call a form of feedback. Okay, it's a form of feedback. Okay, and feedback in this sense, it's what we would call extrinsic feedback. Okay, so it's feedback which comes from outside of the individual. We'll look at internal feedback or intrinsic feedback in a moment. Now, other examples of verbal guidance, we could be talking about peer feedback. And what we mean by that, and anyone who's sort of studied teaching or coaching styles, you might know this is the reciprocal style. Peer feedback is where the coach or the teacher or the trainer equips the performers to coach one another. And therefore, it might be because the players are given coaching cards, for example, and they observe one another's performance and they feed back on one another's performance based on that information. So, of course, it increases the amount of verbal guidance which is available, and it means that performers are not waiting for the coach, who very often there's only one of them, to come and look at their performance and offer feedback. So it's a nice way of doing it. And the other real nice example of this, and I would suggest to you this is a really important one, is Q&A sessions. Okay, Q&A is a form of verbal guidance. Okay, now I'm going to give you a quick example of this that I actually experienced in the last couple of days. So on a Saturday afternoon, coaching men's football on a Saturday afternoon, we were playing one of our last games of the season, and we came in at half time and we were 2-0 up in an away game. And basically the first half had gone in a way that was, we were under pressure the whole of the first half, not having a lot of possession, this kind of thing, and we scored 2 breakaway goals. So rather than bringing the team in and telling them, we want you to A, B, so we want you to sit deep, we want you to defend for long periods, we want you to want you to break rapidly, develop quickly with the pace that we've got out wide. Rather than saying all of these things, we asked the players simple questions. Okay, when did we make chances in that first half? And the players said to us, well, it's when we were on the break. How many high-quality chances did our opponents make when they had possession of the ball? Not too many. So what's the best way of us to play in the second half? Well, we should sit deep and we should hit them on the break. And we did that and we came out with a good performance. But that doesn't matter. But you take my point. Rather than telling performers what they have to do, eliciting the response perhaps makes it more meaningful for the performers in a question and answer session. And they're very likely to come up with the right answers. I'm banging on. Positives. Again, verbal guidance is what we would describe as cheap. It's available. That's very positive. It's always available. Okay, so it's a very common experience within a practice scenario, of course. But there are some negatives. It has no picture. Okay, so it has no visual aspect to it unless we combine it. And again, we've got the possibility of overloading the performer. And I don't mean this is a positive principle of training. I mean overloading in the sense that if we give too many coaching points, for example, if we give 10 coaching points to a novice learner, they're not going to retain that information. So we have to chunk it up and keep it nice and simple. Let's look at manual guidance. Go up to the top here. Let's have a look at manual guidance. Okay, let's have a look at manual guidance. Let me use my green for this one. So with manual guidance, we are talking about physically guiding a performer, to physically guide a performer. So in other words, the coach will actually put their hands on the performer and they will do what we call physical manipulation, which sounds very threatening somehow, but we don't mean it like that, of course. What we mean here is that, a coach might guide the tennis player's arm into the correct angle of flexion at the elbow in preparation for their serve. So they might actually guide that position without sort of straining a joint. They might guide that position. Or a swimming coach might physically manipulate a performer's legs because they want them to get the feel of the correct breaststroke leg kick technique. Okay, so those would be classic examples. Now, interesting point here, unlike many of the other methodologies, this happens during practice. So it's not something where we break up practice and we do this separately. It's happening during the practice phase. So it's happening during it, which is kind of interesting because that, of course, develops what we'd call the feeling of the skill. Okay, sometimes we call that kinesthetic awareness, but it's the feeling of the skill. And importantly, it's the feeling of the correct skill. Now, we've said already, this is what we'd call a hands-on approach. And we'd also describe this as a form of intrinsic feedback. Okay, intrinsic feedback. So the performer develops this. That's feedback there, believe it or not. They develop this feeling of the skill. And of course, that's very positive for the performer. So let's have a look at the strengths and the weaknesses that kind of used up my colours a little bit here. But on the positive side, we get that feeling, which is good, that kinesthetic feeling. We also get the example that this is a memorable model of learning something. It's something that we do tend to learn because we develop that feeling as well as the instruction. On the negative side, it's what we call hands-on, and of course there's some safety and protection issues around that, but I'm not going to go down that route. And the other point, which is more on the technical side, is that the performer is not controlling the performance. Okay, so the performer is not controlling the performance. The guide, the coach is. Now on the mechanical guidance side, let's finish off with this one before we get on to our question. This is where we use what we call equipment or an aid. Okay, so we use some kind of equipment to guide the performer into the right movement pattern. So a great example would be a harness. So if a gymnast or a trampolinist was practicing a back somersault for the first time, we might use a harness around their hips to actually aid them through the rotation to prevent things like danger and landing on one's head. Okay, so that can be really helpful. Another classic example of this would be something like a bowling machine in cricket, where the machine, and we find the same things in table tennis for serving the ball up, where the machine actually serves the ball up to the performer. Now we can describe these in some cases at least as high-tech methods, but they can also be very simple. Let's look at the positives. It helps to develop safety. Secondly, it provides consistency to the skill. So we actually get to practice the skill rather than, waiting for a bowler to deliver the ball in the right place, for example. But on the negative side, we have, that's an 8, a lack of realism. Okay, so it doesn't seem to be it's not exactly like the real situation, such as performing a somersault or receiving a ball from a proper bowler, and it can lead to reliance or over-reliance by the performer. So it can be a weakness in that sense that the performer can end up reliant on this model. Now, what we want to do with all that information is we want to take it down and have a look at this question here. Now, the first thing I want to say to you is that this is a tough question, all right? In one sense, the content we're going to include is relatively straightforward because it's all the stuff about guidance we've just discussed. The problem with this question, if we go through it together, Joe is being coached on the tennis serving action. Yeah, we can see that. That makes sense. Discuss the ways in which Joe's coach might guide him to the correct technique. So first issue with this question is it doesn't actually say the word guidance. Okay, so first of all, is this question about guidance? You may find sometimes in your exam questions that the exam questions are worded in a way that doesn't directly point exactly at your subject content. Here we get this kind of term, how Joe's coach might guide him. And of course, if we're guiding, we're using guidance. I mean, it's obvious, but we need to understand that. Secondly, the command to discuss, as we've said in numerous other recordings and live shows so far, we've got a situation here where discuss does not tell you exactly what you're looking to do. Discuss literally means talk about main points. Okay, talk about main points. But the issue we have is that behind a discuss question is usually one of these skills. It's normally an evaluate, which we could do here. We've got the strengths and weaknesses of each of our methodologies, so we could evaluate each one. It asks you to analyze sometimes. To analyze means to break it down into parts and explain it. Sometimes it asks us to compare. When it asks us to compare, it usually says something like, discuss the similarities and differences of X and Y. Okay, so perhaps we're not doing a compare here. And so what have we got in our question here? Well, in my opinion, we've got an analyze question. So remember what analyze is. It's to break down and it's to explain it. Now, if you are on an exam board who are convincing you that to analyze something means that you give strengths and weaknesses, while I utterly disagree with that in any kind of linguistic sense, you do need to do that. Okay, so discuss that with your teacher. If your exam board, and there is at least one out there at the GCSE PE level, if they consider analyze to be the same as evaluate, then of course what you're going to do is you're going to follow that model, and what you're going to do is you're going to perform an evaluation. You know, you're going to be talking about mechanical guidance negative, it relates to over-reliance, and other positives and negatives of the other methods. But what we're going to do is we're going to break this down and explain it, because we're going to consider this to be an analyze response. So how would we start that? Well, by the way, I'm using color, just so you know here, the black is just text. So it's just, I don't know, what would you call it, like filler. The orange is what we'd call skill language. So, you know, I'm going to be breaking this down and explaining it. So any kind of breaking down and explaining language. And green is key terms, or if you like, correct answer. Okay, so that's how I've broken this down. So let's go through it. And you are going to need to spend longer on this than I am going to, as I demonstrate this now live. Joe's coach should use a combination of visual, verbal, manual, and mechanical guidance. So I've already made my first point, which is about the combination. So I'm going to get credit for that. Would I get a circle and a tick for each of visual, verbal, manual, and mechanical? Well, I've only named them there. You can call it identifying. Maybe I would, maybe I wouldn't. But what I now want to do is I want to analyze. I want to break it down and explain it. So what's the first one I'm going to break down into? Firstly, look at that key language. I'm clearly analysing. I'm breaking this down into parts. Firstly, visual guidance could be achieved through, there's our classic explaining language. Remember, break down and explain. Achieved through a high-quality, clear demonstration of the serve by, classic explaining language, the coach or another performer. Okay, this means, classic explaining language, Joe would create a mental picture of the skill. This can be backed up with the use of video demonstration or even performance analysis software, allowing Joe to compare his performance. So all I've done there is I've taken my visual guidance and I've got my key knowledge down in an explanatory structure. So I've said through, by, this means I'm explaining. And I've got some really great content that's gone into my answer. And that is it. That's as hard as it needs to be. Next one. Let's just move down here. Secondly, Secondly, so again, I'm analysing, I'm breaking it down. Joe's coach will use verbal guidance by, explain language, providing coaching points as a form of extrinsic feedback. An example would be, and I'm giving an example here, Joe, your front foot should point to the opposite net post. Will I get some credit for giving my example? The coach could also use question and answer sessions and even peer feedback. Okay, verbal guidance works by providing high-quality linguistic information. I actually meant to write that earlier, I didn't. High-quality linguistic information to Joe. Okay, so again, I've broken it down into my verbal bit, my verbal chunk, my verbal breakdown in the analysis, and I'm explaining it. I'm using by, I'm using through, I'm using that kind of language. Thirdly, Joe's coach might use manual guidance by, explain language, physically manipulating him into the correct position. This means Joe would experience the feeling of the correct skill through this hands-on approach. So I'm using key language within my answer here. Now, again, I could give an example here. Perhaps I write what I said before. The coach ensures that that Joe has less than a 45-degree angle at the flexed elbow in the preparation phase of the service action by physically manipulating the arm into that position and dragging the racket further down towards the lower back. Okay, so I could use that sort of coaching point. And of course, what I'm going to do finally is I'm going to do fourthly and write all about mechanical guidance. So again here, with mechanical guidance, we could be using all kinds of things. We could be using targets. We could be using hoops. We could be using elastics around Joe's shoulders to make sure that he gets the right rotation around his spine as he goes to hit the serve. We could be talking about that kind of mechanical guidance. I just kind of ran out of space here, so I'll allow you to do that last one itself. Now, can you guys just draw out from that a couple of key things? One is I've clearly analysed because I've broken it down and I've explained it. Let me give that health warning again. If your exam board, for some reason, argue that analysing is the same as evaluating, you must put into your answer your strengths and your weaknesses. Okay, where have I gone? Your strengths and your weaknesses. You must put those in. Okay, your positives and negatives, because they are going to be required. Speak to your teacher if you're unsure about that. And of course, if this question was evaluate the ways, you would automatically put that information in because you're creating an evaluation. But for us, we deem this to be an analyze question, so we broke it down and we explained it. So we're going to address the idea of goal setting. And my main priority with goal setting is I want you guys to have a really good understanding of SMART targets. Just let me tell you that if you are on the IGCSE course, you need to have a really good example of smarter targets. You have this ER on the end for exciting and recorded. Nobody else does. In fact, while I'm thinking about that, let me actually put in place for you something that I think you might find useful. Each of you, basically, depending on the exam board you're on, whether you're here on AQA or whether you're here on IGCSE or anything in between, you have slightly different keywords which make up this acronym of SMART or smarter. All right, so I'm going to talk about all of them here, but obviously for you guys, you just need to make sure that you're picking out the one that is relevant for you. So make sure that you know whether you're an AQA, if you're studying on AQA or Edexcel, and so on and so on. So I'm going to cover all of these, and I'll probably keep reference checking back to make sure everyone's got it nice and clear, but it's useful for you just to clarify that situation, because if you are on AQA and you've got this term here of accepted, and in a moment I talk about the concept of agreed, or I talk about the concept of achievable, you just need to make sure that you can decipher it for your own uses. Now, usefully and positively, the first of these is that targets must be specific. Okay, now, when we're talking about specific target, why have I done that? When we're talking about specific targets, we are talking about making targets relatable to certain specific criteria. So classic examples would be things that we make our targets related to an energy system. So are we targeting aerobic or anaerobic development? We target our training, or sorry, I should say, we focus our targets on the component of fitness. So we're going to talk about Kate in a moment, who's a triathlete. So obviously we're going to be particularly interested in cardiovascular fitness, or what you might refer to as cardiovascular endurance. Okay, so we might focus our targets on the component of fitness. It can be on a body area. Okay, so we can specifically focus on something like strength of the shoulders, if we're a thrower, for example. So it could be related to a body area, and it can also be related to what we might refer to as individual differences. Okay, and what I mean by that is that, if we are working with, let's stick with the thrower theme. Let's say we're working with shot putters. Well, we're probably going to target our training quite differently if we're working with a group of 25-year-old shot putters compared to a group of 13-year-old shot putters. Okay, we may have to cater our targets to the audience with whom we are working, or indeed, if we're saying our own targets, who we are as an individual. So we can make targets specific in that way. So later on, we're going to talk about Kate as a triathlete. With her, it's fairly obvious that she's going to work on, for example, she's going to make her target specific to the aerobic system, and she's going to focus her targets on CV endurance. I know some of you call it CV fitness, but I'm sure you know what I mean. Okay, so CV endurance. So this would be a classic example of how to make a target specific. Now the M again is consistent. We are talking about targets being measurable. Now, measurable means that success within the target is objective. Okay, so it gives a particular measurement or performance indicator in something like a fitness test scores, a classic example, fitness test scores, or as I just said a moment ago, performance indicators. Okay, performance indicators. So we may take a key or central feature of, let's choose a different example. Let's choose tennis. We may take a different example of a tennis player, and we may look at the key performance indicators that relate to that performance success. So if we were to take the serve, for example, we looked at it a bit earlier on, we might take the percentage of first serve success, and we might combine that with the speed of the first and the second serve, and use those as performance indicators to make our targets measurable over a particular time scale. And I am going to also mention here time scales, even though we're going to talk about times elsewhere, because time scales, of course, allow us to make training goals measurable by their nature. We're going to improve by so-and-so percentage in so-and-so test in 6 weeks would be a classic example, even though we're going to talk about time later. Now, on fitness tests, just a piece of guidance I would give. Different books say different things on this, but a classic example is saying something like 5% improvement on a fitness test score. Okay? So that can be on any fitness test score. If we're talking about Kate and her triathlon again, we might be looking for a 5% improvement on her multi-stage fitness test score over a 6-week continuous training program. Okay, so we can use that as a measurable entity within our targets. Now, this is where it gets a little bit weird. Okay, so on the A, you'll notice up here we've got accepted, we've got, where are we? Achievable, we've got agreed, and we've got agreed. Now, first things first, first of all, I'm going to write this in black because the yellow won't work. But for me, when I think about agreed and accepted, I think about them as the same principle. Okay, and what we're saying here is we agree or we accept these goals in combination with people. Okay, so we set the goals in association with coach or trainer. Okay, and what we mean by that is that the individual performer is, whatever goals are set, let's take that 5% multi-stage fitness test improvement over 6 weeks, that should be agreed not just by the performer setting it for themselves or the coach setting it for the performer, but between the coach and the performer. It has to be that way. Okay, now we also want to have a look at the idea of achievable. Hang on, do you have a... Goodness me, James, I put an... Let's spell it correctly, shall we? Achievable. Okay, so with achievable, what we want the target here to be, we want it to be challenging, but not impossible. Okay, so a nice way of picturing it is you want the target to be just at the fingertips reach of the performer. They can just get there, but it's achievable. It's not impossible. It's not some pie in the sky destination that is never going to be arrived at. We're setting a target which the performer can, if they push themselves, get to. In other words, it's achievable. It's achievable in that context. And that's what we want, challenging but not impossible. That's why if we come back to this 5% figure, if we said, right, Kate, we want a 25% increase in your multi-stage fitness level, well, it's not going to be achieved. If we said a 1% improvement, well, she could probably do that the next day by trying a bit harder. Okay, so we want that 5% feels like the right area, the right zone for a 6-week training program for someone who's already at a good level of fitness. Now, we move on to our R's. And again, you'll notice here that we've got realistic, we've got recorded, we've got realistic, and we've got realistic, even though we've got another R here. So let's assume it's realistic to begin with, and I'll mention recorded for you in a second. So with realistic, it's very similar to the concept of achievable. In fact, in my opinion, these ones that have got achievable and realistic within the same acronym, I don't really think it's very helpful. So by realistic, we mean it's achievable. We can say that within time frame, as a really loud airplane seems to be going past, within the time frame, this should be very, very possible to achieve whatever that target is. That's what we mean by realistic. Okay, so we've got to also think that realistic leads to a notion of motivation. You know, the individual performer or the group of performers feel identified and implicated in the challenge of achieving the goal because it can be achieved. If you set something that can be achieved and the performer doesn't achieve it, of course it kind of feels difficult because why was that? Why wasn't it achieved? So realistic is important. Now, for those of you where were we on recorded, where's the recorded one? So OCR, you guys in a second, just bear in mind that I'm going to talk about recorded just here, so you can pick it up just there with me, okay? Now, the other example of our T, we've got timed or time phased or what we call time bound. Okay, this is all the same point. Just make sure that on your exam board you're using the correct term. AQA, you're going to use time bound. Edexcel, you're going to use time bound. OCR, you're going to use timed. Eduqas, WJEC, you're going to use time phased, and IGCSE, you're going to use time phased. Just make sure you're using the right term for your particular specification. But the key thing here is that we have a deadline. Okay, we have a deadline. Now that deadline can be what we'd call medium term. That would be something like 6 weeks. But we will have more macro goals that will be long term, and it could be something like 18 weeks. Okay, so we're going to have a situation here where we have a time commitment to make the goal achieved. Okay, we commit to that goal and the performer or the performers get to that goal within that time phasing. And of course, it's very good for developing focus and motivation. Now, the only thing I'd say that would sort of change this is that sometimes within training things go wrong, things change. Someone has a muscle strain and can't train for a week. You sometimes have to sort of move the time phasing to suit the particular scenario or the individual athlete. That's why we come back to that point of specific targets. So it's not that you set a target in stone, no matter what, you don't shift from it. No, sometimes you do have to shift from it, and it's useful to know that. Now, for you IGCSE cats only, you've also got an ER. So E means exciting. Okay, so we want the goals to be exciting. I like to use the term compelling. Okay, compelling goals. And of course, what this leads to is a feeling of motivation. Okay, the performer wants to achieve that thing. I think it goes hand in hand with that achievable, realistic point. It has to be possible. And finally, we've got our recorded point. Okay, recorded. Now, with recorded, we could be thinking, and let me remind myself, recorded was both relevant for IGCSE BODs, but we've also got recorded, which is important for you OCR dudes in there, okay? So, recorded. We've got things like a training diary. We've got things like a wall chart. We've got things like record keeping. You know, if you think of something like resistance training, weight training, it may well be that the athlete keeps a record of every single rep and every single resistance and every single set that they take, so they can see clearly exactly what amount of work has been done and what hasn't. Now, recorded is an important thing because, of course, those records are what are going to allow the individual and the trainer to be informed going forward to reset targets again in the future. So that recording is an important point as well. Okay, so there's our SMART principle. Lots of information there. Let's have a look at a question here. I'll make this slightly bigger. Hang on a second. Never like doing this sort of live on where you guys are watching in case I screw it up somehow. So practice questions. What have we got here? We've got using specific examples, explain how Kate could use the SMART method to establish compelling goals. So I'm looking at explaining how. We already know that if we're explaining how, we're using language like through, we're using language like by. So-and-so happens by, so-and-so is the case through the process of. That is how we explain how something happens. And down here, look, we've got a 6-mark question, okay? So let's have a little go at this. Let's start it off. What have we got to begin with? Again, same structure. We've got black is just text. We've got orange, which is the skill language. It's going to be things like through and by, because I'm explaining how, so it's going to be like that. And the green is key terms. Now, obviously, you're not going to write in black, orange, and green in your exam because you're going to write in black. But in terms of this practice methodology, it's quite useful to do it this way. Let's have a little look. Kate could do this by making goals specific. Okay, so there's that point, but I've got to give more details to get my mark to her aerobic energy system. The most important component of fitness, CV endurance. Okay, now maybe I'm going to get a sub-max there. Okay, I can't get more than 2 marks for any particular letter of the acronym. It is likely that this will involve continuous training, so this would probably get me a mark as well, but I've got my submax to improve these areas. So what we're saying here is that we're using continuous training to work on CV endurance as an aerobic athlete. We're making training specific, or we're making goals specific. Next series of points. To improve these areas, Kate must make goals measurable. Okay, how does she do that? By relating targets to fitness test scores and performance indicators such as split times. Okay, so I'm literally saying we're going to measure split times as a performance indicator, and we're going to make our goals associated to those, such as we want to improve our transition times between the swim and the bike and the run. We want to improve those by 5%. Okay, that would be a good example of making things measurable. Measurement allows Kate to be very focused on the exact variables that are planned for. Okay, so we could potentially get some credit for that, but we've got our submax. Let's keep having a look. What have we got next? Nice. Kate must use targets that are agreed. So I've used agreed, not achievable here. If you're an achievable, you must write achievable, okay? They are agreed. Okay, so there's our key language. By setting them in association with the coach, okay? We get a mark for that one. And I've got here, or other performers. If you think about goal setting, it's like a team sport. Think about field hockey, ice hockey, korfball. If you just set targets that are only relevant for the individual, it might not be in association with other performers in the team. So by setting targets in association or agreed with targets for other players, we get the combined effect. Let's keep going. Whoops, didn't mean to do that. The targets must be realistic, so there's our R, we haven't looked at recorded here. By, there's our explaining how language. Challenging but not impossible, by being challenging but not impossible. Okay, how many have I got there? 1, 2, 3, 4, 5, 6. I've actually got my max there already for my 6 marks. An example would be improving multi-stage fitness test score by 5%. So look, here's my example. Okay, so the question asked me for examples. We must give examples. Split time, an example. Fitness test score is an example. Continuous training, an example. Okay, let's move it on, even though we've got our marks. Finally, Kate's targets must be time phased, and I remind you, time bound or timed, make sure you use the right language, by setting a deadline for the target. Now, of course, you IGCSE bods, you guys are going to go on to talk about exciting. We want the targets to be really compelling and motivating for the performer, and recorded. We want them to be written down, training diary, record keeping, that kind of thing. So you could keep going in that environment. But the key thing to me is, the key thing I'd like to draw out of that is I've clearly explained how, And I've clearly talked about SMART goals in relation to specific examples. Again, remind you, the specific examples are things like, I'm going to use continuous training. We're going to look at fitness test scores or performance indicators. Maybe I could, sorry, I should have said split times. There's my example. We've got here, challenging but not impossible, 5% improvement over 6 weeks. It's an example. And deadlines, probably I should have given another example here at the end, in truth, okay? So the deadline, the training improvement must be achieved by the 7th day of the 6th week, for example, in the example I gave above. So, guys, what I would say to you is, I'm sure you'll have been given a lot of guidance by your teacher over the 2 years or even 3 years you've been studying this course. That's great, okay? But some of this stuff is just common sense. Some of this stuff, if you're asked to give examples, give examples. If you're asked to explain how, you should be using language like through and by. If you're asked to do that in the context of SMART targets, you should literally write exactly everything you know about SMART targets within that framework and that structure. So in many ways, this isn't rocket science. You need really good knowledge. You need to understand what the command terms are and what they mean. Goodness sake, have a look at our roadmap service. It's magnificent for achieving that. And beyond that, you get all your knowledge down onto that page. Now, if your teacher has been saying to you, we'd like you to use a P method or an idea method, I suppose you should. Okay, I suppose if that's what you've been working on over the course of 2 years and you've become really, really good at it, then by all means do that. And it's probably going to be very functional for you. But also don't neglect how straightforward sometimes these structures can be. Sometimes you just need to look at what the question's asking you to understand the structure of that question, and then within that response format, get all of your knowledge on the page. And that's what I feel I did in this particular answer. Okay, so mental preparation. Now, oddly, the first thing I'm going to do with our mental preparation session is I'm going to talk about something which we predominantly think about as a physical idea, and that is the idea of a warm-up. Now, while you may not look at your mental preparation section of your textbook, or for the case of you AQA guys, you might want to look at arousal and arousal control. The warm-up, of course, is not just a physical, but it's also a psychological process. So I want to remind you of a couple of things about mental preparation and a warm-up. Okay, well, first of all, we often have, depending on what sport it is, we often have some notion of a team talk, okay? Now, of course, that might not apply to Josh directly in his sprinting, more of which in a second. It's also, get ready for this one, see how many of you get this within your warm-up. It's time for quiet thought. Okay, now, if we build a warm-up effectively, it allows individuals, even within team scenarios, to have quiet reflection time and thinking time in preparation for what they're about to do. There's also a relaxation process in the sense that it is time to socialize, which can prevent negative thoughts and can allow athletes to feel more relaxed, more comfortable in their sort of social zone at the right moment. And of course, the other point is that it improves. It's a good physical warm-up, I should say. Good physical warm-up actually improves our psychology, and it's what we call the physical to cognitive connection. The physical to cognitive meaning thinking, the physical to cognitive connection. So by preparing properly, and this would include days and weeks before as the same idea. Now, if we're physically fit, if our skill has been well developed, then our tendency to have good psychology is obviously much higher. And it's the same with the warm-up. Now, we also have things like calm discussion of goals. Okay, we emphasize the word calm there, calm discussion of goals. Okay, that is clearly a psychological process. Use the words targets instead of goals if you prefer. And we also have the use of what we'd call performance goals. Focusing the individual on aspects of their performance that are going to impact the quality of what they're about to do, rather than focus on we need to win today. We would focus on performance goals, which is getting our tactics right, getting our structure right, getting our strategy right, getting our positioning, whatever, getting those things correct, getting our technique right. That getting those things correct, of course, leads to more tendency. Now, I just mentioned this warm-up factor because so many of you need to think about warm-up not just as a physical but as a psychological preparation factor when you look at that topic. Now, we haven't looked in detail at warm-up and cool down within this revision section. But I just wanted to mention it in here because I do think it's important for you guys as well. Just reflect on that. Now, what I do want to do now is I want to focus on Josh. Now, Josh is over here. He's a bit of a legend. Here he is, old Josh. He's a good sprinter. He's a young man, but looks older, and he's very, very good at running. Okay, but we want to specifically know what mental preparation techniques should he be considering with regard to his psychological and mental preparation. Now, I'm going to go through basically a bit of a list, and let me remind you that if you are an AQA student, where this becomes interesting for you guys is controlling arousal. Okay, so you probably want to learn this in relation to a topic that you study, which is called controlling arousal. For everybody else, well, certainly for Edexcel OCR and WJEC, you want to think about this as mental preparation, okay? But just so you guys in there, AQA, just so you're aware, you just need to think about that with regard to controlling arousal. Now, all that being said, let's get on with it. So first of all, I want to bring your attention to what we might call imagery. Now, for Josh, I think it's fair to say imagery is very likely to happen pre-performance, okay? Pre-performance. Now, the reason that is because his performance is so rapid and it's going to be over so quickly, and he's focusing so hard on the physical aspects of his performance that a lot of the psychological aspects are going to come pre-performance. Now, bear in mind, for other performers, let's take something like a rugby goal kicker, or a goalkeeper preparing to save a penalty. These processes could well happen during performance or just prior to a moment during performance, okay? So we're talking about Josh here, but there's no reason why these can't be mid-performance for other athletes, all right? So let's think about it in that way. Now, a couple of things first of all. When we talk about imagery, we are talking about imagined pictures. Okay, now that doesn't give a lot away to begin with, and we're going to sort of develop this out, but we're talking about imagined pictures. We are talking about the process, and I'm going to go further with this in a moment. We're talking about the process of mental rehearsal, more of which in a second, okay? Mental rehearsal. We are talking about the process of either what we would call internal imagery. Okay, internal imagery is a very interesting concept. Okay, it's what we would describe as actually picturing oneself doing. So it's what we call doing the performance. So, in this case, Josh would picture himself getting a great sprint start, getting his pickup just right, and so on, and dipping at the line. So it's picturing ourselves doing. It's very much related to feelings of the skill. What does it actually feel like? And it's very much related to movements, okay? So what would those movements actually feel like? And you often see when people are undertaking internal imagery that they'll actually move, they'll actually perform an aspect of their performance which relates to the movement of which they are visualizing. So just bear in mind, we call that internal imagery. Now, we also want to have an awareness of what we call external imagery. External imagery. Okay, now external images is a slightly different concept. It's where the performer will picture, it's where they'll picture from outside. So you could think about this almost like Josh, for example, imagining his performance on a video. Okay, he's imagining watching himself. Okay, and that would be what we'd call external imagery. There are other forms of imagery where we do external imagery. We imagine someone else performing, for example. I'm not going to get into that now, but there are those methodologies as well. Now, I also want to sort of say about imagery, I think it's really important we get this point. I've touched on it already. It's what we'd call a multi-sensory experience. So look what I've just said there. You develop the feelings of the movement. You develop sort of emotional feelings and the feelings of the skill. You actually, in this sense, you've obviously got the visual stimulus. We've actually got the multi-sensory aspect of this. And of course, people will also imagine the sounds that they're going to hear. In Josh's case, maybe that first ripple of the bee of the bang, for example. They would imagine that. So we'd call this a multi-sensory experience. We'd also say about imagery that it increases confidence, okay? So it is a process which is going to help Josh or an equivalent athlete feel more confident in their performance. It also reduces what we'd call anxiety. Remember, anxiety is things like worry and apprehension and negative thinking, more of which in a few moments' time. And let me just draw down here. It increases concentration, okay? Now, a couple of things I want to add to this, Okay, a couple of things I want to add to this. When we talk about imagery, I've just focused very much on what is the technique aspect of the performance. So I've just focused very much on what is the technique aspect of the performance, actually how it feels. And we'd actually summarize all of that as mental rehearsal. Okay, but just so you know, there is a way of visualizing where we just focus on relaxation. Okay, we visualize something which is completely non-stressful, even completely separate and not related to the sporting performance at all. Okay, we picture this relaxing environment so we can switch off from the stress and the concern of the impending performance, which perhaps is very, very meaningful. Okay, so we've got this different notion. So just be aware that, of course, mental rehearsal in this sense, we talk about it performance or technique based. It's that mental rehearsal preparation of the performance itself. But just be aware that visualization can include non-performance related imagery. Okay, so imagery, visualization, which is non-performance related, which is related to relaxation. So it's important just to remember that, because it's a different factor that we don't often talk about. Now, I also want to talk to you about the notion of self-talk. Now, you may have been told from a very young age that the first sign of madness is talking to oneself. Well, it turns out that was not a very reliable piece of information, because self-talk is a really, really, really positive experience for promoting high quality sporting performance, assuming that all of the physical stuff has been done well. So with positive self-talk, what are we talking about here? We are talking about a process that promotes positive thinking and feelings. Positive thinking and feelings. Now, first of all, realize that positive self-talk and imagery can happen in combination with one another. Okay, so we sometimes refer to positive self-talk as a mantra. A mantra is always repeated. It's important to remember that self-talk is going to be some kind of repetitive affirmation. I really like the word affirmation in this context. Affirmation basically means it's positive. You know, the simplest of simple examples would be, I can do this. I can do this. I am. Someone might repeat themselves over and over again. I've prepared hard for this event. I'm ready. I've prepared hard for this event. I'm ready. I'm ready. I'm ready. These positive self-talks or affirmations are going to promote this idea of positive thinking and positive feeling. Now, what we want to also address here is that self-talk can be negative, or it can become negative. And I would hazard a guess that all of you would have experienced this at some point. And when we say it can become negative, what we want to do with self-talk is we want to prevent it. So it needs preventing. Okay, so we're looking to prevent this negative self-talk, and we do this through a process that we refer to as thought stopping. Now, it seems very blunt as a process, but we are literally saying here that if Josh has in his mind, sorry for drawing on your forehead, Josh, but if Josh has in his mind this worry or apprehension or negative thinking which enters his mind, he completely ignores it. He prevents it from entering his kind of processing of information. Okay, so he completely ignores that negative thought, and he returns presumably to this affirmation that's repetitive and mantra-based, which promotes positive thinking and feeling. I'm ready. I'm ready for this. I've prepared well. I'm going to get the perfect start. These sorts of affirmative, positive self-commentary. And it, of course, this often comes down to habit and tendency, if we're more likely to do this or less. Now, a couple of other points I want to focus on with you. I want to talk a little bit about the notion of, let me use that colour. I want to talk a little bit about the notion of selective attention. Those of you that study something like basic information processing would already know a lot about this, I'm sure. But with selective attention, what we're saying here is that we focus attention on only key factors. Okay, so in other words, we only focus attention on key factors, and we call those key factors relevant stimuli. Okay, so let's have a think about that. Josh might be lining up on the start line, and is there any point in him? Does it affect his performance in any way? Does it promote his performance in any way to look at the person in the lane next to him and think something like, they look like they're going to run fast today. No, it doesn't make any difference to their performance whatsoever. It will not reduce their time whatsoever that they're looking to run. So you just ignore that stuff. We sometimes call it tunnel vision or blocking things out, and we're going to call it here selective attention. So we're also talking here, we're not just focusing on the relevant, we're going to ignore, or let's call it filter out, irrelevant information. Okay? So, an example of irrelevant information in sprinting is the runner next to you. There, it's meaningless. It doesn't matter. The only performance factors are the timing of the gun going off and the quality and the speed of your running technique. Nothing else influences that performance. Okay, so on that basis, we can filter everything else out. Now, of course, that does vary from performance to performance. In many sports, you have to be very focused on your opponents. Team games would be an example. I like to describe selective attention in the following way. It helps us to reduce noise from the environment. Now, I don't literally mean noise, or it could be. I'm talking about stuff in the environment which doesn't matter to performance, okay? It doesn't matter. We filter it out. We block it out. The other thing I'd say about selective attention, it is a skill. It takes time to develop the tendency to do this. So if you think about it, we need to know what's relevant in order to filter the other stuff out. And, of course, we need to actually learn how to do it. So selective attention is a skill, and it does take time. And you'll often find with younger performers, inexperienced performers, it will take them longer in order to identify and then actually correctly remove those things. Okay, so that's all of the information I want to sort of go over. Let's have a little look at some questions. I left myself a lot of space. Here we go. Let me just put this in the middle. Nice. Okay, a bit more space. I'm being asked to describe. Now, when we're describing something, we often say what it is. We often say is characterized by. It's characterized by. We often say is like. We often say is not, when we say it's not, or it's not like, whatever. And we often say is composed of. And if you look at those linguistic sort of those kind of useful linguistics there, what we're saying there is we're simply giving the characteristics or the details of something. We're not saying why, we're not saying how, we're not saying anything about explaining, we're simply describing it. And what the other thing I draw out here is I'm describing two mental processes. So in other words, I have to choose two and write in detail about two, and in this case, enough to get 6 marks. Now, I think this would be a tough question in your exam, amongst the toughest you get if you were, what was that? If you would get this particular question here. But we're going to describe two mental processes that Josh could use prior to race, so it's before the race, to improve his chances of winning. Okay, so let's have a little look at what we talk about here. Big answer, but let's take our time. The first is, notice the language, positive self-talk. Okay, so I'm going to get a mark there, which is characterized by repeated affirmations or mantras. Okay, so I might get a mark for affirmations. There's my 2 extra. I've probably now got a sub-max. Okay, because I've got 3 marks for the first one of those 2. Notice here, what have I simply done? I've said what it is and is characterized by. And that's all you have to do in a described question. It's all you have to do. So self-talk also includes blocking negative thoughts. Maybe I would get some marks for this if I hadn't before, such as apprehension and worry or doubt. The second is imagery, okay, which is characterized by creating visual images of success or good technique. Okay, maybe I get my marks there and I get to my max. And I've also said, or relaxation. Imagery helps to increase confidence and reduce anxiety. Okay, so I'm saying what this thing is and what it's characterized by. I'm not saying why, I'm not saying how it's done. I'm simply describing the concept. Let's move on. By the way, on these questions, you do need to return to these. If you're in the live show, even if you're in a classroom, you can pause and drag this back and take some time looking at the characteristics of that answer if you choose, because we've got the DVR on the live show, so you can do that if you want to. But let's move on. Now I've got a different command. Now I'm being asked to explain why. When we're asked to explain why, we're going to be talking about things such as because, therefore, comma, this means. You can also have things like as a result. These are classic, this causes. These are classic things for explaining why. Explain why Josh might use visualization during training and before he competes. Okay, so let's have a little look at what we've got. This is because, notice I'm explaining why, it reduces anxiety. How many marks am I looking for? 3. Increases confidence and promotes a sense of relaxation. Okay, I'm probably done with that single sentence. Okay, but let's see what else we've got. We've got here, therefore, comma, I'm explaining, I'm making sure I get my knowledge down. The tendency for best performance increases. And isn't that ultimately what it's about? The tendency for best performance increases, because ultimately that's why you would use visualization, because it promotes the possibility of best performance within the competition. So we're explaining, just notice the difference between explaining why and describing characteristics. Is this, is that. Explaining why, it happens because, therefore, this means. And those are the differences we really want you guys to sharpen up on with regard to these sort of exam-based skills in preparation for your exam. Okay, let's have a little look at feedback. And I've forgotten to put my other headphones in, so let me quickly do that. Hang on a second. There we go. Need to be able to hear the feedback myself, you know. So on this feedback, this is kind of where the fun starts. Okay, so I've got to show you a little bit of mad preparation that I've done ready for this. I'm going to go through all forms of feedback with you now. Okay. But you guys have to look at that list in quite a bit of detail, not least because it's in my scrawny handwriting. So look, what I've sort of stated here is that if you're an AQA student, you need to focus now on positive feedback, negative feedback, knowledge of results, knowledge of performance. If you're with Edexcel, you need to focus on intrinsic, extrinsic, concurrent, and terminal. If you're with OCR, you need to do intrinsic, extrinsic, knowledge of results, knowledge of performance, positive and negative. In other words, you guys nearly have a full house. And if you're on WJEC or the Eduqas board, you're looking at knowledge of results and knowledge of performance only. Now I'm going to go through all of these methodologies. You guys obviously need to pick out the ones which are important to you and the ones that you're likely to be questioned on. Okay, that, let me be clear, that is your responsibility, not mine. I'm going to go through all of it and you're going to pick out the bits which matter to you. So make sure you focus back. I will relate back to these things as we go. So that being said, let's get on with it. And we've got our tennis player here. He's a bit of a novice. He needs to learn. He needs to improve. And first of all, I want to focus on extrinsic, and intrinsic feedback. Okay, so extrinsic and intrinsic feedback. Again, just reminding you what I said before. This therefore relates to Edexcel students, to OCR students. So you guys need to be switched on at this point. So what do we mean by extrinsic feedback? So the first thing I would say to you about this is it's information coming from outside. Okay, so it's coming from outside. And the way I like to word this is from an outside source. Okay, OURCE, of course, from an outside source. So this is going to be things like coaching points. Okay, so if we have our tennis player athlete Joe here, and he is receiving coaching points from an experienced tennis coach, such as this is the correct foot position, this is the correct elbow angle, this is how you stand, this is how I want you to toss the ball, etc., etc., etc. That is going to be a characteristic of extrinsic feedback. Now, coaching points often come prior to performance, but they also come in the form of feedback on trial attempts. So what we mean by that is that the coach might say to Joe, good effort, which we're going to talk about as positive feedback in a second. But what I want you to do is I want you to change your foot position, and this is the foot position I want. Okay, that would be a classic example of extrinsic feedback in the form of coaching points. Now, the other thing you might want to think about with extrinsic feedback is it can come in the form of teammate feedback. Okay, so a teammate who perhaps, you know, you're in a hockey match or something like that, or you're playing doubles badminton or something similar, and your teammate asks something of you, perhaps in terms of strategy. Move more to your right, raise your racket, right, you defend the back, whatever. That's going to be sort of a form of extrinsic feedback as well, which is informing you of the quality, in this case, of your performance. But don't forget, a lot of what we want to focus on here is the quality and the feedback during the learning cycle. In other words, a teammate might give you feedback during some kind of practice scenario. And finally, we describe extrinsic feedback as what we would call environmental. Don't forget the N, environmental. It's because it's external. because it's outside source, it is an environmental form of feedback. So what does that mean? Well, we can structure the environment to make sure that the athlete gets the best possible extrinsic feedback that's going to cause them to learn. What would be a classic example of that? Working one-to-one with a really high qualified, excellent coach. Why is that going to work? Because they're going to be available as an extrinsic outside source of information, but or as well as they've also got high quality information to share and to correct. Now, intrinsic feedback tends to be, or is a little bit different. First of all, it's from the performer. Okay, so intrinsic feedback comes from an internal source. We often refer to it as the feeling of the skill. Okay, so what does the skill feel like? Does it feel correct? Now, you'll know from playing whatever sports that you play, you will know when the grip feels right, or your stance or your balance feels right. It's that classic feeling, is I'm in balance or not. You will know, for example, that you made good contact with a ball, say, and you'll have these sort of intrinsic internal feelings. But remember, in order to have that, you have to have experience of having done it correctly a number of times in order to recognize the correctness of what you're doing. So we can refer to this as what we describe as kinesthetic. Okay, so kinesthetic means that it's based on the feeling of the skill. So let's just tick off what we've done. We've done internal, external for you Edexcel and OCR boards. Let's move things on. I'm now going to finish off Edexcel because I'm going to talk here about concurrent. The new Edexcel, guys, you can switch off until we do the questions in a moment. Concurrent and terminal. Okay, so concurrent and terminal sounds like some of the more complex stuff. Let's go through it. So for concurrent, we're saying that it's feedback during performance. Concurrent is another word for meanwhile, as it happens. So it's feedback that comes during performance, and it's what we'd call an immediate response. Okay, so let me give you a classic example, which would be both concurrent and actually intrinsic. I'm on a slope and I'm skiing or I'm boarding or whatever, and I feel out of balance, so I adjust my position. That is a form of concurrent feeling, concurrent feedback, that I'm feeling out of balance, so I adjust my performance. And of course, in this case, it's also intrinsic. So notice how these combine. Must have an E. So let me write on here. It's often internal. Although not always, it's often internal, but not always. And a great example is the one I just gave now. Things like balance, or what we'd call equilibrium. Okay, am I in a balanced position or not? And do I need to adjust my performance? I often think about concurrent as the need to make adjustments. Okay, so we need to make, that's an M, an E, an N, a T, and an S. So we need to make adjustments sometimes in performance, and concurrent allows us to do that. Now, terminal feedback is a very different, or really, it's the contrary, the opposite. It comes in the form of the end of performance. Okay, so at the end of performance, we get feedback on how that performance went. So a kind of a real base and simple example is, did we win or lose? Okay, that is terminal feedback on the performance quality and how it went. We can also think about something like racket sports. Did the ball, shuttle, whatever, did it go in or out? This is terminal feedback. Think about a basketballer or a netballer shooting for the net, or a footballer or a rugby player kicking for the goal. It's shooting, in other words, or taking penalties. Did it go in or out? Did I score or not? This is terminal feedback. So therefore, it's what we'd call result-based feedback. And of course, if you think about it in that way, if you do take 10 basketball set shots and you miss 9 of them, I guess ultimately you're likely to change something based on that feedback, right? I got 9 out of 10. Therefore, maybe I should change something. I need to change my technique. Is that when we start working with the coach and developing some extrinsic feedback in the form of coaching points? So this terminal feedback is at the end of performance. So where are we? Let's tick off again. We've got concurrent for Edexcel, terminal for Edexcel, ticked off. Let me just turn over my page. Bear with me a second, folks. So we also now want to, and I'll do positive and negative last. We now want to look at the ideas. We now want to look at the ideas of knowledge of results. Knowledge of results, and here I'm going to look at knowledge of performance. Now, in many ways, these deeply overlap with the concept of concurrent and terminal knowledge of performance. So let's go through these, and let's remind ourselves that for KOP and KOR, We are looking here at OCR, we're looking at WJEC, Eduqas, and we're looking at AQA, all three of you here. So the only ones that don't need to focus here are the Edexcel guys. But learn it, right? It links to your concurrent and terminal. So knowledge of results. So knowledge of results is factual, okay? It's hard facts. It's actually win, lose, in, out. Did I score or not? These are factual outcomes. What was the outcome? What was the outcome? So it's not going to take many of you a stretch to realize this is very closely related to the concept of terminal feedback I just talked about. What was the outcome? And we tend to think about it in things like this. It's things like times. These would be classic examples for athletics, swimming, triathlon, whatever. Times, distances. Let me also say in, out. And we could also put win, lose. Okay, so this again is a form of, at the end of performance, what was the overall factual outcome of the performance? And it's a concept of knowledge of results. So of course, if someone's getting, let me think of an example. If a tennis player is over the course of 3 matches is only hitting 40% first serves in, that's a knowledge of results, and therefore, obviously, we're going to have a look at something like changing that technique or doing something about it. Now, knowledge of performance is something different. How well did performance go? How well did performance go is the question we're asking there. And we're asking as well, or the point we want to make is that this is technique based. Okay, so knowledge of performance could well be something like a performance indicator. A performance indicator. Okay, performance indicator. So let's go back to our tennis server a second. That the elbow angle was in the correct position on each strike that they made in the tennis serving practice. This would be a performance indicator. Whether it went in or not would be the knowledge of results. But the actual performance indicator is the technique of that skill. And by the way, knowledge of performance is often based on the feeling of the performance. Was it correct or not? So it's very closely related to this kinesthetic intrinsic feedback as well. So that's what we mean by knowledge of results. Sorry, knowledge of performance, I should say. There's our KOR, our KOR, our KOP. Those ones. And the last ones we're going to look at here are positive and negative for you AQA guys. So with positive, and it's hard for me to understand why we don't look at this, everybody, but never mind. So positive and negative, okay? Positive and negative. So positive and negative. So we need to look at, in terms of positive feedback, that is, what was correct. Okay, that information is what we would call positive feedback, informing the performer of what was correct about the performance, whether it's outcome-based or performance-based. We're also looking to reinforce. Now, of course, if we reinforce those things that are correct, those things are much more likely to happen again in the future. Okay, so we reinforce correctness, and this makes it more likely that they're going to happen in the future. And they are going to motivate people as well. They're going to motivate people. So the motivational factor comes from positive feedback. Now, don't forget that positive feedback can be both emotion-based, such as praise, and it can also be information-based, okay, such as your technique was correct because. Okay, so it can be praise or emotion-based, or we sometimes call it affective, but it can also be information-based. Your technique was correct because. On the negative side, we tend to think about this as information on errors. Okay, so we get criticism or we get feedback on the things that we've done wrong. So it's a critical process for something like error detection. So make sure you include that term in your answer. And it's also what we call the basis for improvement plans. Okay, so if a coach points out to an athlete, look, we've got the completely wrong hip position on the takeoff in the long jump, then of course that's negative feedback, but it gives a basis for what's going to be worked on next. We're going to work on that hip position. Okay, so that's going to be the basis of this. So it's very closely related to error detection. And what follows error detection? Error correction. Okay, so negative feedback is often the basis of error detection, which leads to error correction. Let's look at some questions. Practice questions. Let's see. Let me go up here. Okay, so what have we got here on this first question? Explain why. Well, we already know this is going to be because. We already know this is going to be this means, or it's going to be therefore. This is the key language we're going to use when we're explaining why. Explain why extrinsic feedback is particularly important to Joe as he learns the tennis serve. So why is it necessary for him to get extrinsic feedback? Let's have a look. This is because, notice the skill, Joe needs high quality information from an outside source. Because he does not yet have the intrinsic feeling of the correct skill. Therefore, Joe needs coaching points. There's my 3 marks. Okay, I'm saying why. I'm not really describing the idea of extrinsic feedback in a lot of detail. I am using some of the key descriptors, but I'm using it with an explanatory "this is because" structure. Okay, and that's what you guys need to get in the habit of doing. Okay, if you're asked to explain why, you must explain why. Next question, explain how. When we explain how, we're typically using language such as it happens through or it happens by things. Through and by is classic explaining how language. Explain how Joe's coach could use both positive and negative feedback to help Joe learn the tennis serve techniques. We're still on the serve. Explain how. Let's have a little look at it. Let me just make my layers available to me. Joe's coach could use positive feedback by, note my language, explaining how, by stating what was correct or using praise. So I'm saying either praise, which is emotion-based, or stating what was correct, which is technique-based. I might get 2 marks for that and get a sub-max. Now, there's only now marks available to me for talking about negative feedback because I've already got 2 for positive. This means Joe is more motivated to repeat the correct action. So maybe I would have got a mark for motivated, but I'm not getting that because I have to talk about negative. What have we got next? The coach will use negative feedback for error detection. Okay? And to create an improvement plan. And therefore, we've got our max. We've got our 3 in there. I've talked about positive. I've talked about negative. I've clearly explained how. Beautiful. Again, you're probably going to need to revisit these questions in a bit more time, in a bit more detail outside of this live experience if you're on the live show, okay? If you're doing this on demand, you can pause and take the answers in. You can, by the way, feel free to try and improve them. There's probably loads of improvements that could be made. These are just my versions, right? Using specific examples, so I must explain how. So again, I'm going to use through, by, explain how Joe and his coach could use KOP to improve Joe's tennis serving technique. So we're interested in knowledge of performance. Let's have a look. Joe's coach will use KOP by informing Joe that your elbow angle was perfect that time. Okay, so there's my example. It's information-based, it's knowledge of performance, it's technique-based. This means Joe received technique-based information. Joe will use KOP by assessing performance indicators as well as the intrinsic feeling of the skill. And there I get my max, okay? So I'm clearly showing my explain how skill. I'm saying through, by. I'm clearly talking about knowledge of performance. I'm using my key language within my answer, and therefore I'm explaining how, with specific examples, how KOP could be used by Joe and I guess potentially the coaching association to improve the tennis serving technique. So really important stuff, guys. For me, the knowledge is relatively straightforward. What I would encourage you lot to think about is the skills that I've just represented and how to get that knowledge into the correct structure on these questions.